السلام عليكم.
وعليكم السلام ورحمة الله.
عليكم السلام.
وعليكم السلام.
وعليكم السلام ورحمة الله وبركاته.
وعليكم السلام دكتور هاني.
وعليكم السلام.
Okay, guys, today, inshallah, we will continue history taking. The last day for history, 50 stations for adult and pediatric and the different approaches, okay, including new diagnosis, explain a new diagnosis. You have to be ready for explaining new diagnosis, whatever in adult or in pediatric, but most likely it will be pediatric, okay? So the father or the mother will come to you, already the patient in ICU or in emergency and in life-threatening condition. So you have to explain to him the diagnosis first, okay? Because the father or the mother is worried about his son. No need to take history in the start, just inform him about the diagnosis. After that, you can take history from him, the opposite way. Okay, so today, Dr. Gol, number 1, Dr. Inas, Dr. Jia, Dr. Ramesh, Dr. Ihab, Dr. Saima, Dr. Tariq, Dr. Subhabrata, Dr. Abu Yahya, Dr. Feo, Dr. Fadia, Dr. Sameh, Dr. Ahmad Al-Amin, Dr. Nasser, Dr. Amjad, Dr. Al-Humaydi. Okay, 16-1 want to practice today. If anyone want to practice, you can raise your hand. So as usual, how to get 10 out of 10? Again, the approach, it's not the big issue. Okay, the approach, it's not the big issue. The difference between candidate and the candidate, the attitude. How to get 10 out of 10, the attitude. Your way, your body language, avoid jargon, give information in chunks, so piece by piece, and check understanding. Also, you have to follow the introduction. If you want to know everything in detail, you can go in introduction, the first decision we started. And you should follow the checklist, okay? And the most relevant questions is concise questions, okay? You have 8 review of systems. Each 2 systems you can ask together, okay? 2 by 2, 2 by 2, okay? If you will ask about GIT, continuous urogenital. If you will ask by dermatology, continue with miscellaneous. Cardiovascular, continuous respiratory. CNS, BNS, continuous musculoskeletal, and so on. So number 3, number 4, it's fixed in all stations. You will ask about skin changes. Number 3, you will ask about night sweat, loss of weight, loss of appetite, swelling. So are talking about number 4. Fix that in all stations. After that, post medical surgery, only one question. No need to ask about other medical disease. Just any medical disease, done. Any surgery, done. You can save time by asking the question by 1 word or 2 words. Okay. Any prescribed medicines, any allergy, any disease run in your family. And social history here, it's 3 questions only, more than enough. Okay. Sexual history only if the station is dysuria or urethral discharge. Okay. And most likely they will ask you in the station, take sexual history. Okay. will be clear. Even it's not clear, it will be obvious when you ask the patient. Okay. So here regarding travel history, also diarrhea or fever. And again, you have to check comfortability of the patient before you start. Comfortability here, it doesn't mean only pain. Pain, one symptom of other symptoms for comfortability. So if the patient has discomfort here means maybe he has pain, maybe shortness of breath, maybe fever, maybe heart racing, or you have to address any discomfort before proceeding. Whatever the station is, history, examination, or anything, okay? If you will move the patient to resuscitation room, it doesn't mean it's a station of resuscitation, no, okay? If you will give the patient, if you will connect the patient to cardiac monitor and do 12 leads ECG, it doesn't mean station of resuscitation, okay? So here, please follow us to get 10 out of 10. And the eyes here, would you like to add anything? Sometimes the candidate forget questions. And once you ask the patient, would you like to add anything? He will say yes, blah, 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 blah. So he will give you the missing information. And what is your concern? Only one question, more than enough. After that differential diagnosis, it start by most likely problem is blah, 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 blah. And we need to roll out blah, blah. Okay. So here to save time. Okay. And the management, whatever disposition, examination in all station, blood test in all station, until the station doesn't need anything, so no need to talk about blood tests. So introduction as usual, as we said, check if the approach is Socrates or Otibara or who approach. Who approach, this is our approach today. Any event, if the station is fall, syncope, fits, misbehaving, alti, confused, or unconscious, blood sugar is low. So you have to ask about who, okay? Here, maybe the complaint is collapse, or maybe the patient will not say syncope, so collapse, okay? Collapse here may be loss of consciousness, maybe fits, maybe syncope, maybe vertigo, okay? Many meaning, so you have to clarify the complaint from the beginning. Don't start any station until you are sure about the complaint. How? Can you tell me more about that? If the patient answered you, but until now it's not clear, ask again. If the patient cannot describe or cannot explain, give him examples. Is it blackout? Is it loss of balance? Is it loss of consciousness? Did you fall? And, okay. Is it dizziness? Is it spinning? So give him examples. He will choose from these examples, okay? You are helping the patient and helping yourself as well, okay? So you are asking who, when, where, why, how, what. Who has seen you with this event? But don't say event. If he came with fall, you can say with this fall. If he came with syncope, you can say who has seen you with syncope or with collapse or whatever. If he came with fits, who has seen you with this fits? Okay, and so on. When did this event happen? Where did this event happen? Why do you think? The reason behind that. How many times this event over the last 6 months? Because if fits, if he said this is the first time, so it means it's the first fit. If he said this is the second or third or fourth time, it means he has multiple fits. Okay. What here means before, during, or after. So before means what were you doing before the event? CNS, was there a headache, neck or back rigidity before that? Any vision problem or eye sensitivity to light before that? Was there a chest pain, heart racing or sweating before that? Was there a cough, sneeze, passing urine or stool before that? Did that happen after standing from sitting position? During, did your witness tell you that you had a foam in your mouth and your eyes rolled back? Were there jerky movements? If the station it's not fixed. If yes, one limb or all limbs. Okay. Did you lose consciousness with yourself? Soil here, it's not important. Did you wet yourself? Okay. And also bite your tongue. How long did it take for you to recover? After the event, did you fall down? If the station it's not fall. If yes, were you able to get yourself above the floor? Did you recover fully? Or did you have confusion after the event? Did you injure yourself? Did you notice bleeding from any orifice? After that, any numbness, weakness, or paralysis before or after that? Okay, so already you ask about CNS, you ask about cardiovascular, you ask about musculoskeletal, so don't ask about these systems. You still have GIT, urogenital, dermatology, miscellaneous, respiratory. So you can ask about GIT, you can ask about urogenital, dermatology, miscellaneous, and respiratory. And continue the general approach. Okay, so as we said before, we finished Socrates, Odibara part 1 we finished, and Odibara part 2 specializations we finished, and we said bleeding it will be in intensity. Okay, and these are the questions of bleeding. Who approach we will discuss today: concussion, cardiac or CNS problem, or maybe pregnancy, diabetes like hypoglycemia, seizure, first or multiple fits, it depends on the station. And pediatric, we will discuss these stations today: dysuria, and here dysuria may be sexual history, maybe UTI, maybe female genital mutilation if female, but unlikely in OSCE station. SOP, you have to check the age. More than 2 years, asthma. Less than 2 years, bronchiolitis. Whatever in history taking or resuscitation. Limping child, the age less than 3 years, tenosynovitis. The age 4 to 10 years, birth disease. The age more than 10 years, SOFI. If the patient or the mother or the father want to do X-ray, ask why you want X-ray. Always explore. Acceptance or refusal, ask why do you want. So because I am worried. Worried about what? Versus disease. Why you are worried about versus disease? Because my nephew, he has some problem before and he has diagnosed what versus disease. I appreciate your concern, but it's unlikely in this age, less than 3 years. And he has no symptoms of that. According to your data, he has no symptoms indicating versus disease. Okay. Rash, according to the age, also according to the symptoms. Vomiting, according to the age, less than if weeks, HBS, if months, intussusception, and check the character of vomiting. Odibara approach, child abuse, whatever non-accidental or not. So here, the baby or the child is misbehaving. Misbehaving here may be abnormal behavior, maybe fits. So it depends on the actor or the station. And the different from candidate to candidate in the same circuit. I will not say in the same day, no, in the same circuit. Maybe the candidate in front of you different than the candidate behind you, different than you, okay? So don't depend on the description. History from a mother, dental abscess, maybe neglect, maybe not. So check. You will understand if she seek medical help or not, and so on. Physical abuse. So they will mention in the scenario the patient has suspicion of non-accidental injury and X-ray showing elbow or femur fracture. So you have to check the notes before you continue with the patient. So here physical abuse, non-accidental injury, it's like any communication station. You have to, I want to turn off my bleep. I want to be in private room and one nurse with me. Have a seat, please, and. So just introduction quickly, don't waste time. It's like 30 seconds, okay? I want to check the notes of the patient. I want to check X-ray, okay? You have to do that before you talk to the patient, okay? So any station with notes or any station with possibility of notes or X-ray, you have to check that in the start. If already in front of you, also you have to mention that. If not in front of you, you have to verbalize that to the examiner, so he will show you. Who approach event in pediatrics, same as we said, Fitz and Alti, explain new diagnosis. So as we said, you will explain the disease, after that the crisis, after that ICE, after that short and long term management plan. After that, you will take brief history, past medical surgery, drug and allergy, prenatal, natal, postnatal, family, and social. Okay. Regarding the pediatric, the most important, don't forget prenatal, natal, postnatal, developmental, and the growth. After that, immunization. And I want you to concise your questions. For example, any medical problem during pregnancy? Was his delivery normal? What about admission? Any admission after that? And what about his development? Or you can say, what about his growing? Is it normal? What about his immunization? Okay. If you don't
The candy, where's the candy?
If you don't want to mention here regarding Red Book, because it's not important at all. Okay. So what about his immunization? Up to date? This is how to ask a question. You can concise questions. Okay. Next one, Dr. Gol.
Yes, Dr. Hani.
Yeah, you have 30 seconds to prepare yourself.
Okay.
You can start.
Good evening. My name is Dr. Gul, one of ED registrar. May I know your name and age, please?
Yeah, I am Khaled, 39 years.
Nice to meet you. I have been asked to take some data from you. Is that okay?
Okay.
Are you comfortable?
Yeah.
Do you have any pain?
No, I'm okay.
So how can I help you today?
Actually, I have a fall. It was 2 days ago.
Oh, I'm so sorry to hear that. I need to connect you with cardiac monitor, check your vitals and blood sugar. Is that okay?
Okay.
So can you please tell me more about your fall?
Yeah, I was in the farm and I slept. After that, I fell down on my head.
Oh, I'm so sorry to hear that. So could you please tell me who has seen you fall
My wife,
and when did you fall?
I told you 2 days ago.
And why do you think that you fell?
I told you I slept.
So how many times have you fell over the last 6 months?
This is the first time.
Okay, so was there any headache, neck or back rigidity when you fell down, before you fell down?
No,
Any vision problem?
no,
Any change in sensitivity of light?
no, no,
Was there any chest pain racing of your heart?
no,
Any dizziness before you fell?
no,
Was there any cough, sneezing?
no, no,
Or did you pass stool or pass urine before you fell?
no, no.
So did your witness told you that when you fall, there is any frothing from your mouth?
Yeah, yeah.
And was there any jerky movement of your body?
Yeah.
It was one limb or both limb or all the body?
She said all 4 limbs.
And I'm sorry to hear that. Did you lose your consciousness?
Yeah, yeah,
And did you wet yourself?
yeah.
And how long did it take to get recovered?
Like 5 minutes.
Okay, so after fall, was you able to get up from the floor?
No, she helped me.
Okay, and when did you fall? Did you lose? Did you when you get recovered? Did you have any confusion after that?
Yeah, yeah.
And did you sustain any injury?
No, no,
And was there any bleeding from any orifice?
no,
Any numbness, weakness, paralysis during
No.
or after fall?
no, no,
Do you have any tummy pain?
no,
Change in frequency of your bowel?
no,
Change in frequency of your urine?
no,
Any skin rash?
no, no,
Any change in color of your skin?
no,
Do you have any cough, breathing difficulty?
no,
Any weight loss, change in appetite?
no,
Increased body temperature, night sweats?
no,
Lumps and bumps?
no, no,
Any past medical history?
no,
Any previous hospital admission?
no,
Any previous surgery?
no,
Are you on any prescribed medication?
no,
Do you have any allergy?
no,
Any family history of similar condition or any disease runs in your family?
no.
So could you please tell me with whom you are living or what you're doing for your living?
I'm working in my farm with my wife. We are living there.
Okay, so I'm sorry to ask a few personal questions. Do you smoke?
Yeah,
Do you drink alcohol?
yeah, sometimes.
Or by any chance use any illicit drug?
No.
Okay, so would you like to add anything that I missed in, during my conversation?
No.
So what is your concern?
I have no concern. I am okay, but my wife, she's worried about me. I don't want to come here. I want to go home.
I appreciate your concern and I'm really sorry what she's feeling about you. Actually, you fell down and there are a lot of reasons for this fall. It could be related to low blood sugar, low blood pressure, and it could be related with brain and heart as well. And as you fall down with the jerky movement, so actually we need to do head imaging for you. And what we're going to do in order to confirm our diagnosis, we will take a detailed history from your wife, and after
Thank you.
that,
Thank you.
okay.
Okay. So what do you think, guys?
We have an obvious reason for falling, slipped and fell down. Just need imaging for the symptoms of the fall.
Okay.
Yes.
This is most likely seizure activity.
What do you think about the performance of Dr. Gun? I don't care about the comments now. What is the good thing?
Very good.
Flow.
Excellent performance.
Excellent approach.
Very nice performance.
Okay, me also.
Tone and confidence. Yes.
Very good. Yeah, yeah. For me, it's amazing, but I want you to concise more. Okay.
Okay.
Yeah,
Okay.
you are doing well. You are doing well, but I want you to concise more. Okay. For example,
Okay.
any past medical disease, more than enough. No need for any recent hospital admission. Okay, no need.
Okay.
So try to concise more to reach the differential diagnosis and the management. Okay. And
Okay.
sometimes, guys, you will find clear diagnosis. Okay. For example, the patient will say, I have blood disease before hemophilia. Okay. So it's clear. He told you something clear, right? I told you I slept and I fell down, right? So
Yeah.
it's a mechanical fall, right?
Yeah.
Okay, so it's clear. So I appreciate your concern. He want to go home, right?
Yeah.
His concern here is the opposite way.
Okay.
His concern doesn't want medicine. His concern want to go home, but he came just because his wife, she is worried. Okay, so I appreciate your concern. Even he want to go home, it's a concern also for him. Okay, I appreciate your concern. For me, it's a clear cause for your fall. As you said, you slept and you fell down. But I am worried. So you are a physician now, but I am worried because after you fell down, you have blah, 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 whatever, it depends on the stage. You have fits, you have whatever. If he said numbness, paralysis, anything, he will say, okay, I know you are okay now, but you have symptoms indicating to do imaging, head imaging. Okay, so you have to show him that you are worried. Very well done, Dr. Gol. But here,
Thank you.
yeah, I need to take further data from your wife, and I am worried because you blah 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 blah. We need to do examination. Even you will not say brain and the nerve and the heart. No worries. We need to do examination. We need to do some blood test. We need to do head imaging, and we will see. We might refer you to a fall clinic. Okay, this is the most important. But again, try to concise your questions. Okay.
Okay,
I have
doctor.
questions,
Thank you.
please.
Anyone want to say something?
Yes, Dr. Hani, my question,
Yeah.
can I clinically differentiate between the fits due to mechanical problem and, for example, due to epilepsy? Can I differentiate between them clinically without?
Yeah. So here you have CNS cause, you have cardiovascular cause, and you have also mechanical cause. Okay, so if the patient has anything before the fall related to the heart, so it's a cardiac cause. Anything before the fits related to CNS, for example, the patient has headache or blurring of vision or any symptoms neurological before the fits, it's a CNS cause. Okay, if the patient doesn't have anything before that, and he said I fell down after that I have fits, so it means the reason here is the fall, head injury. Okay.
Okay. So because the scenario or the feature of it's here, it looks like epilepsy, but the patient slept before that.
Yes, it's a mechanical cause. But if the patient did not fall, and the patient have symptoms of neurological before the fits, it means it's a CNS cause. Okay.
Okay, fine. Thank you
Yeah.
very much.
Yeah, welcome.
Sir,
Yeah.
in the scenario, you told that he
Again, your voice is distorted.
He can wet himself. You told in the scenario that he wet himself when he fall. Yani, is that means mechanical fall or another neurologic fall?
No, all these events happen after he fell down, right?
Yeah.
It means
If
it's mechanical. Mechanical here. It's an injury. Mechanical, it means injury. Okay.
Yeah, if mechanical, why he will wet himself?
Because of head injury. He has head injury. After that, he has neurological symptoms. He cannot control his nerves. Okay.
Okay. It means
Okay.
that there is central injury. Yeah. Okay.
Okay. Maybe concussion. The diagnosis here, concussion, because he's okay now, right?
Yeah.
Okay.
Okay.
And you can inform him. You can inform him what happened to you. It's called concussion. So the examiner will understand. You are professional. Okay. So anyway, guys, the most important here, don't discharge the patient. Okay. Dr. Gia. Dr. Gia.
Hello.
Yes.
Assalamu alaikum, Dr. Hamid.
Alaikum salam. How are you? You have 30 seconds.
I'm good. Okay, I'm ready.
You can start.
I'm going to wash my hands, put on my PPE, and greet the examiner. Honey, there is a lot of disturbance. Just a minute. Hello.
Yes.
Can you hear me?
Yes.
Can I start from the beginning right now? Hello.
Yes, you can continue, doctor, please.
I'm going to start right now.
Okay.
I'm going to wash my hands, put on my PPE, and I'm going to greet the examiner and greet the patient. Hello, I'm Dr. Gia.
Sorry, Dr. Gia. Sorry, you have something wrong with your connection.
Yeah.
Maybe mic or.
Honey, that is the problem. I'm hearing my own voice again. I'll continue after the next person.
Because you have.
What's wrong with me?
You have two device. You joined with two devices.
1 second.
Okay, we will continue with the other doctor, please, to save time. Dr. Ramesh. Dr. Ramesh.
Dr. Hani, is it okay now?
Yes,
Okay.
Dr. Hani.
Okay, you can continue, Dr. Jia, please. We want to save time.
I'm sorry for this. Okay.
Okay.
I'm going to
Okay.
wash my hands, put on my PPE, and I'm going to approach the patient. Good morning. I'm Dr. Jia, ED registrar. May I know your name and age, please?
Yeah, I am Sami, 31 years.
Nice to meet you, sir. I've been asked to collect some data from you. Will that be okay with you?
Okay.
So, are you in any sort of pain or discomfort or anything that I can help you with some medicines?
No, I'm okay now.
So you're comfortable right now?
Yeah, yeah.
So will it be okay if a nurse attends with us?
Okay.
And do you have anyone waiting for you outside?
No, no.
So, Mr. Sami, how can I help you today?
Yeah, I was collapsed.
I'm very sorry to know of this. So when did it happen?
Yeah, 2 hours ago.
Did it happen before?
No.
What were you doing when it happened?
I wasn't at work and I was sitting, fixing my papers.
Okay. So who witnessed this event?
Yeah, my colleague, she was talking with me. Suddenly this happened.
Okay. So so you said you're fixing your paperwork and then all of a sudden it happened and didn't happen before, right?
No, this is the first time for me.
Okay. Did you feel any chest pain or any shortness of breath or anything like that at this time? Or any heart racing?
Heart racing, yeah, I felt the heart racing before that.
Okay. So did you have any headache or blurring of vision or anything associated with that?
No.
So were you trying to stand up from a sitting position?
No, I was sitting.
Okay. So did you cough, sneeze, or try to pass urine or stool?
No, no.
So you mentioned your colleagues witnessed this event, right?
Yeah.
Okay. So did she notice anything like frothing or jerking of the limbs?
Yeah, it was jerky, yeah, in my hands.
Okay. Did she notice any soiling of the pants or wetting of the pants?
No, no.
Okay. So how did you wake up? Do you remember anything?
What do you mean by wake up?
Like wake up from this fall? You
I
said
did
you had
not
a fall,
fall.
right?
I did not fall.
Like collapse, you mentioned, right?
Yeah.
So how did you get up? Did you get up with a start?
I did not fall, doctor.
Okay, so you said you had a collapse and you said you had jerking of the limbs.
Yeah, in my upper limb.
Okay, so how long did it persist?
Yeah, it's like seconds.
Did you lose your consciousness then?
Yeah, but seconds.
Only for seconds?
Yeah.
Okay, so do you have any past medical condition?
No.
Okay, so were you hospitalized in the past?
No.
You had any surgeries?
No.
Are you on any medications?
No.
Do you have any drug allergies?
No.
So are you in any committed relationship?
Yeah.
Okay, so did you travel recently?
No.
I'm going to ask you some personal questions. Do you smoke?
No.
Do you drink alcohol?
No.
Is there any chance that you could be taking any illicit drugs?
No.
Okay, so what are your ideas and concerns, Mr. Sami?
I am worried. What's the problem?
Okay, thank you for your information, Mr. Sami. The data that I have collected, it could be very likely that you had a seizure. And for this, we're going to move you to the observation room. We're going to run a thorough examination of your of the body, and we're going to do some blood tests. as well as we'll involve our consultants from the neurology department, and we'll do a scan of your brain. And I would also like to advise
So will you do head imaging for me, doctor?
Head imaging, yes, because since it's a seizure, and we'd like to see if there's any abnormality in the head, so scan as per the advice of the consultant might be necessary. And also I would like to advise you not to indulge in any dangerous activities like swimming or driving till the diagnosis is confirmed. Is that understood?
Okay.
So do you have any questions for me?
No.
So are you happy to proceed with the management? Yes. Are you happy to proceed with the management?
Okay.
Thank you very much. I will wash my hands, remove my PP.
Okay, your time done. What do you think, Dr. Gia?
Initially, I got there was some problem with the network, and that caught me off guard. And
no problem. Here, what do you think regarding the station? What is the complaint for you? What is the complaint? This collapse, is it dizziness? Is it vertigo? Is it loss of balance, blackout, syncope, or what?
He had jerking of the limbs, and there was soiling of his.
I don't care about the jerk movements now. Jerk movement can be with anything, okay? But here, what is the complaint? Guys, what is the complaint, guys?
It's cardiac. It's not clear because not digging deep to the explain the complaint.
Excellent, excellent. This is my point. Not clear because he did not ask me. Can you tell me more about that? Number one, and also he did not explore more. Okay.
Palpitation is very important point here.
Yeah. Okay. So can you tell me more? It will give you marks in the exam. It means you are a good listener. The examiner will check you are listening, you are an active listener to the patient. Okay, you will work in the UK or any other hospital. They want you to be a good listener to the patient. Okay. Number two, here you ask me how long it take for you to wake up. I did not tell you I fell down, right?
Yes, yes.
And you did not ask me, did you fall down? Okay. This number one. I did not tell you I lost my consciousness. So you have to tell me, did you lose your consciousness? If I will say yes, for how long? Did you fall down? Clear, Dr. Gia?
Yes, yes, absolutely. Yeah.
Yeah. Okay. Here, I have jerky movements where one limb or four limbs. I told you upper limbs. Okay. So I have symptoms before that. What do you think? The symptoms I mentioned, is it neurological? Did you ask me about headache, vision problem?
Yes, I asked you about headache, vision problems, and you said you had palpitations.
You asked me about heart racing. I said yes. I have heart racing before that. So is it neurological cause or cardiac cause?
It's cardiac cause.
Cardiac cause. If I have jerky movements sometimes because of electrolyte imbalance, sometimes because of heart problem, right?
Yes, yes.
Okay. So it doesn't mean I need head imaging here. Okay. So
yeah.
The most important, guys, you have to give clear idea to the patient. Okay. What would you like to add anything? Did you ask me this question?
No.
So would you like to add anything? Okay. After that, what is your concern? I appreciate your concern. According to your data, the most likely problem, it's heart problem. So if you ask me, would you like to add anything? You know, I was preparing for what?
Yeah.
My uncle died in young age. Okay.
Okay.
So would you like to add anything? Very, very important. We'll give you marks. Okay. So here, in the exam, I forgot. I have this station. I got in this station 9.5. Okay.
Okay.
I forgot, and he said my uncle, he died. His brother, sorry, he said his brother died in young age. You know what I said? I told him, it's good that you came early. Okay. Anyway, yeah. This patient, he showed me the ECG when I mentioned the ECG, the heart tracing. Okay. So I want someone to do this station again. Dr. Ramesh?
Okay.
Yes, doctor.
Yeah. Okay. You can start.
Certainly. Okay, good morning. My name is Dr. Kumar, AD physician. May I know your name and age, please?
Sami, 31.
Mr. Sami, nice to meet you. Okay, Mr. Sami, I would like to ask a few questions regarding presentation today. Is that okay with you?
Yeah.
Mr. Sami, how can I help you today?
Yeah, I was collapsed, doctor.
Oh, I'm sorry to hear this one. So I would like to check the vitals of patient and blood sugar level. Okay. So Mr. Sami, can you please tell me more regarding your collapse?
Yeah, I was at work, and this happened when I was sitting, and I was talking with my colleague. It was like 2 hours ago, and while we are talking, suddenly this happened. She was witness to me.
Okay. So did your witness tell that you lose the consciousness?
Yeah.
Okay, for how much time? Any idea?
Like 30 seconds.
Like 30 seconds. Okay. Did the notice any jerk movements of your body?
Yeah.
Okay. Did you wet your paint?
Yeah.
Okay. Any bite of your tongue?
No.
Did they told you that when you have jerk movements of body that your eyes were rolling upside or your head was turning towards one side?
No.
Okay. So before this event happened, did you notice any blackout or any headache?
No.
Any racing of your heart?
Yeah. I felt my heart was racing. Yeah.
Okay. Any chest pain?
No.
Okay. So when you lose this consciousness, did you injure to any part of your body?
No.
Okay. So when you wake up, and where did you find yourself? Are you aware for the environment?
Yeah.
Okay. Why do you feel confused?
No. I was fully conscious.
Excellent. Okay. Did you notice any weakness or numbness of your arm, face, or any other part?
I'm okay now. I'm okay now.
Okay. So do you have any previous episode?
No, this is the first time.
The first time. Okay. Do you need any problem with your bowel or bladder functions?
Normal.
Any fever, lumps or bumps in your body?
No.
Any rashes, any part of your body?
No.
Okay. Do you have any past medical illness?
No.
Any surgeries in the past?
No.
Do you have any allergies?
No.
Okay. So are you currently taking any medication or any prescribed medication?
No.
I would like to ask a few questions regarding personal health. Is that okay with you?
Yeah.
What do you do for your living?
I'm a teacher.
Okay. Do you smoke or drink alcohol?
No.
By chance use any recreational drug?
No.
Okay. Is there any disease running in your family?
No, but you know, my uncle, he has died when he was 20 years.
Oh, I'm sorry to hear that one.
Yeah.
Okay. So do you recent history of travel abroad?
No.
Mr. Sami, do you want to add anything more, or you want to inform me anything more?
I am worried, doctor. Do I need head imaging or anything?
Mr. Sami, I appreciate your concern. The information which I gather from you, the most probably cause of your fall, it may be something related to your rhythm of the heart, as you told that your cousin has some issue with the heart. But at the same time, there are multiple reasons, something related to the electrical activity of the brain, something related to electrolyte imbalances of the body, something related to the blood sugar of body. Okay, so what I'm going to do, I'm going to do keep you in observation, do the full physical examination of you, examination of your body, head of nerves. Okay, at the same time run some blood test, and as well as the tracing of your heart. Okay, so when all reports will be ready, we will revise this one. If needed, we can. Okay, this heart. Okay, the ECG. Okay, Mr. Sami, this I have performed this ECG, so I'm sorry to inform you there is some rhythmic abnormality in your heart. Okay, that we call this Burgoda syndrome. Okay, so what I'm going to do, I'm going to give you some medication, and I'm going to involve the cardiologist. Maybe you need some one equipment that we call the ICD, implantable cardioverter defibrillator, as a definitive treatment for this one. Is this my management plan is okay with you?
So I will go home now.
No, Mr. Sami, you will be with me. You will be in our observation room. I will involve because this is some genetical electrical rhythm problem in your heart. I'm sorry to say for that one. For that, I'm going to involve the cardiologist, and you need for the this one instrument that we call ICD implant.
Is it serious, doctor?
Mr. Sami, I appreciate your concern, but it is a good that we have catch this earlier and you are here, so we will do our maximum best to treat that one. Is this okay with you?
Thank you, Dr. Ramesh.
Thank you.
Okay, well done. Here, number one, you move the patient to resuscitation room, connect the monitor and the 12 leads heart tracing, and check the vital signs. Any patient with heart racing, with collapse, with chest pain, okay, with dizziness, okay, with hematemesis or any bleeding, so move to resuscitation room, connect to monitor, and check vital signs. Okay, if the patient related to the heart tracing to the patient. Okay, after that, check comfortability. After that, check pain. After that, you can proceed with data. And proceed with data, I need to take some data from you. You are not, guys, taking consent. Some people, you are not taking consent. It's very, very important. After everything, I need to take some data from you. Important, okay? Yeah. You did very well. You asked very concise questions. That's why you save time, okay? But here, the management plan, you are not controlling the phrasing, okay? So, would you like to add anything? What is your concern? I appreciate your concern, okay? The most likely problem for your collapse today is heart. If the station is brain, is brain. If the station is something else, you can mention, okay? So what we are gonna do now? Keep you in resuscitation room because you moved him in the start to resuscitation room. I will keep you in resuscitation room. Do examination, some blood tests, heart tracing. They showed you the heart tracing. Oh, I see the heart tracing for you. I am sorry to tell you, it's showing syndrome which is called the Brugada syndrome. It's a genetic problem. So what is the problem here? Until now, you did not inform the patient, is it serious or benign, right? I am sorry to tell you, it's a serious problem because high risk of what, guys?
of this early
Sudden-
disease.
Sudden cardiac
I don't care about this. It's a high risk for irregular heartbeat.
Yeah.
Irregular heartbeat. Arrhythmia means arrhythmia, but I will not say arrhythmia. It's a serious problem because of high risk of irregular heartbeat. So we will consult cardiologist now. You might need to insert a device into your chest, which is called implantable cardioverter defibrillator. It will help to prevent any irregular heartbeat. It will protect your heart. Done. Finish. Okay. You will get a high mark. Okay, guys?
Yes.
Okay. So you have to inform the patient the diagnosis, serious or benign. So, for example, sexual history, you have to inform the patient, low or high risk, right? You are taking data from the patient. Why? He came to you. Why? To understand the problem is serious or benign, right? You have to be clear with the patient. Okay, well done. Next one, Dr. Ihab.
Yes.
Dr. Yes.
Yes.
You have 30 seconds. You can start.
Wash my hand, wear PPE. Hello everyone, my name is Dr. Ihab. I'm one of ED physician. May I confirm your name and date of birth, please?
Yeah, I'm Karim. I'm not the patient. I'm her colleague. I brought her. She was collapsed at work.
Nice to meet you, Mr. Karim. So, what is your colleague name?
Yeah, her name is Nadia.
Okay, Nadia. How old is she?
She is 43.
Okay, Mr. Karim. So this Miss Nadia, what happened to her? May I know? How can I help her?
I don't know, doctor.
Okay, we will proceed to Nadia. How are you, Miss Nadia? How are you, Miss Nadia? Okay, we need to check her vital, and also we need to keep her on observation and check her blood sugar.
Vital signs are normal. Blood sugar is 1.
Okay, we will give this Miss Nadia dextrose 10% IV, 200 ml. Can you give, please, nurse? How is she now?
Yeah, I am okay now.
How are you, Miss Nadia? You are in safe hand, and how can I help you today?
I don't know what happened. I was at work and suddenly I collapsed.
So sorry to hear that. This Miss Karim, are you okay if he will be with us?
Yeah.
Okay, and this nurse also will be with us. So I will collect some data from you regarding your what happened to you today. So can you tell me more what happened?
Yeah, I was at work and I was sitting. Suddenly, I was talking with Mr. Karim, and suddenly I was collapsed.
So sorry to hear that. So Mr. Karim was with you, and as you told me, and
Yeah.
this happened in your work. Okay,
Yeah.
and why you think this happened to you?
I don't know.
And this happened to you before, or this is the first time?
First time.
So what you were doing when this happened to you?
Yeah, I was sitting. I was talking with Mr. Karim, and suddenly this happened.
Okay, as you told me, and you have this headache or any neck rigidity or vision problem when this happened to you, before this happened to you?
Yeah, I felt like dizziness, sweating, and suddenly I was collapsed.
Your head was spinning?
Just a dizziness.
Dizziness, okay. Okay.
Yeah.
So where is there chest pain or heart racing or sweating before this happened to you?
No, no,
Was there cough or any sneeze?
no, no,
And now you are standing or you are in
no,
sitting
no. I was
position?
sitting. I was sitting.
Okay, and you didn't fall down.
No, no.
Okay, and this during happened to you, this Mr. Karim told you that you have any foam in your mouth or your eye rolled back,
No, no,
and you were having any jerky movement.
no, no,
Did you soil yourself or bite your tongue?
no, no.
And did you lose your consciousness level?
Yeah, I came here unconscious.
Okay, so sorry to hear that. And for how long do you think this happened? Mr. Karim told you how many times?
Like 15 minutes.
And did you sustain any trauma before or
No,
after you fall?
no, no.
Okay, and how and you do now you are recovery full or you feel confused?
No, I am okay now.
And you did you injure you? Okay, any numbness or paralysis or weakness in your limbs?
No, no,
Okay, did you throw out or feel sick?
no, I am okay now.
Okay, did you have any problem in your bowel motion or change in your urine?
No, no,
Okay, did you have any skin rash or change in your skin?
no,
Did you have any high temperature?
no,
Did you have any cough or shortness of breath?
no,
Did you loss of your weight or appetite?
no,
Okay, did you have any lumps or bumps in your body?
no.
Okay, Miss Nadia, did you have any past medical history?
No.
Do
Yeah,
you
yeah,
have
I
any
remember. I remember. I have diabetes. Yeah.
So sorry to hear that. And you are taking regular medication,
Yeah.
or oral or injectable?
These are the medicine.
Where is the medicine?
Yeah, medicine for thyroid, medicine for diabetes.
You have thyroid also.
Yeah, yeah.
Where can I see the medicine? I am not seeing the medicine. And these tablets?
Yeah.
Okay, okay. And you don't have any other medical issue?
No, no. Only thyroid
Okay,
and diabetes.
and you are taking this regular medication for a long time. And do you have any allergy?
No.
Do you have any past surgical problems
Thank
before?
you. Thank you, Dr. Ihab. Okay.
Okay.
You are doing very well, but you are asking everything in details. Okay. That's why you did not reach the management plan. Okay. I will give you 30 seconds.
Okay. What is your concern, Miss Nadia?
I don't know, but I'm worried maybe it will happen again.
Okay, I do appreciate your concern. It is genuine. From the data I collected from you, most probably you have something called your glucose in your blood decreased. That's why you fainted or you lost your consciousness. And we will give you an observation area. We will do for you. I will do for you full clinical examination, and I will extract blood from you. I will do for you this hemoglobin A1C to check your control of your sugar. Okay, and I will consult our endocrinologist to adjust a dose for you, and we will check your meals. Maybe you took this medicine before the meal.
Thank you.
Okay. And
thank you, Dr. Thank you. Okay. So here, guys, you will explain the diagnosis in the start or in the end?
in the start.
In the start.
In the start. Okay. So here you can talk to the patient. If the patient is not answering, no need to ask again and again. No need to waste the time. Okay. And no need to take too long in introduction with the colleague. So, good morning. I'm Dr. Ihab, the registrar, the most senior here, and I'm here to talk with Mrs. Nadia. She's not talking, okay? So he will say, I came here, she was collapsed at home, and. Thank you for bringing her. Mrs. Nadia, don't waste time with him. Mrs. Nadia, how are you? She's not talking. I need to move the patient to resuscitation room. Patient collapse will be an observation or resuscitation?
Resuscitation.
Resus, not observation.
But here, the scenario written Karim brought 43. Okay, okay.
Okay, so here I need to move Mrs. Nadia to resuscitation room, connect her to monitor, cardiac monitor, check her vital signs and the blood sugar. Don't say vital signs only. This station appeared to me in the exam. I asked him about vital signs. He said normal. I asked him about blood sugar. He said 1.5. Okay, so vital signs not including blood sugar. Take care. Okay. Anyway, he will tell you 1.5 or 2 or 1. Anyway, it's a low blood sugar. I need one nurse with me. Don't waste the time. Don't ask the examiner, do I have nurse? No. I need one nurse with me. Insert IV access, give dextrose IV. Mrs. Nadia, yeah, I'm okay. Explain to her what happened. Okay. You came here by Mr. Karim and the ambulance. It depends on the station, depends on the scenario. And your sugar was very low. We give you dextrose and you are okay now. Are you comfortable? Yeah. Do you have any pain? No. I need to take some data from you regarding your condition today. Is that okay? Okay. So step by step, okay, guys? After that, you will go for whole approach. Already, are you aware about what happened? It means, can you tell me more about what happened? Okay, open question. You have to let her to talk. Okay, this is how to get 10 out of 10. You give the patient a chance in the start to talk. Okay, because it will help you for everything. So blah, 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 blah. Okay, what I understood, Mr. Karim was talking with you and you were collapsed and you said at work and continue. No need to ask the same questions. So this, when did that happen? 2 hours ago or 1 hour ago? And is this the first time? First or second, depend on the station. Okay, so ask about whole approach after that quickly. And here regarding symptoms, you can concise symptoms. And do you have any symptom now? No, done. Okay, no need to ask here, do you have chest pain? Do you have bowel or urine problem? Do you have heart? Do you have high temperature? Do you have any symptom now? Okay, because this happened now. Okay, if you want to ask anything before, no worries. Okay, so after that, she will show you medicine. Just tell her, okay, I will review your medicine. So she will show you maybe diabetes, maybe thyroid medicine. Okay, what are the reasons, guys, for hypoglycemia?
First, medication.
Number one.
Non-diabetic,
Number one,
diabetic reasons.
diabetic reasons. Number 2, non-diabetic reason.
Non-diabetic reasons.
Okay, diabetic reason. Yeah, diabetic reason. So the patient has diabetes. Non-diabetic reason, the patient has a thyroid, the patient has malaria infection, the patient has sepsis, okay? The patient has also liver disease, okay? Addisonian crisis, okay? So you have to think about all these problems. You can tell here, according to your data, the most likely problem you have low blood sugar, because maybe you have diabetes, maybe you did not ask about the medicine of diabetes. Is it a tablet or injection? If injection, so did you use your medicine, whatever tablet or injection, regularly, the same dose? Okay. So did you eat before taking your medicine? Okay, and so on. So in a way, according to your data, most likely problem because of your medicine, or maybe because of your thyroid gland problem. But we need to rule out other causes, like what? Like liver, like infection. Okay, so what we are gonna do now, keep you in resuscitation, because already the patient you put her in resuscitation from the start. Keep you in resuscitation, do examination, check your blood tests, including for blood count and infection screen, liver function. So you mentioned the most important tests. Okay. Well done, Dr. Ihab, but ask about, yeah, well done. Ask the most important and the most relevant questions. I need you to reach the differential and management plan, but without skipping the most important points. Okay. Dr. Tariq?
Yes.
You have 30 seconds.
Dr. Hani, excuse me, before
Yeah.
Dr. Tariq will start, I will talk about this DEFLA, or I need to mention this driving license for
Yeah,
hypoglycemia.
very, very important. Yeah, you remind me. I mentioned that in previous sessions. So regarding DVLA, if the patient has aware, if the patient is aware about the hypoglycemia, so no need to stop driving. But if not aware, she should stop driving, right? Okay. And how to know that? You should ask clearly, directly. Are you aware about low blood sugar? If she said yes, so you have to confirm. Are you aware about symptoms like dizziness, sweating, feeling cold? Clear, Dr. Ihab?
Yes, clear.
Yeah. I asked her in the exam. She said, yes, yes, I am aware. And she mentioned all symptoms of hypoglycemia. Okay. So if the patient is aware, no need to stop driving. As I remember, you can confirm me, guys, as I remember. Anyone to confirm this point? Guys?
دكتور هاني
Yeah.
يعني السيشن دي سيشن بتاعت history يعني we need to mention this driving things in this history session, or this after management, after discharge the patient, we need to discuss that with her.
Yeah, excellent. Excellent. The most important, I want you to finish everything. If you still have time, you can give extra points. Okay. So don't mention about DVLA, and you did not mention the management plan, right? But if you finished your station and you finished the differential diagnosis, you finished the management plan, you can talk about driving. Okay. Yeah. Okay, Dr. Tariq?
Yes, sir.
Can I start?
Okay. I will wash my hand and wear PPE. Hello, Miss Nadia. I'm Dr. Tariq, one of the senior doctor working in emergency department today. May I know your name and age, please?
I am Nadia. I am 33.
Nice to meet you. I have been asked to take some data from you. Is it okay with you?
Okay.
Do you want someone to attend with you?
No.
Are you comfortable at this time?
Yeah, I'm okay.
How can I help you today?
Yeah, today, doctor, I have convulsions.
I'm sorry to hear. I need to keep you in resuscitation room, and I will attach with the monitor and check your vitals and blood sugar. Are you comfortable? Are you okay now?
Yeah.
Can you tell me more about your convulsions?
Yeah, I was at work, and my colleague told me that I have a problem in jerky movements like that.
And when did it start?
Yeah, it started 2 hours ago.
Do you know how did it start? Suddenly, or there was some progression?
It started suddenly.
Is it happened first time, or do you have any problem before?
No, it first time, yeah.
Do you have any idea why it happened to you today?
I don't know.
And what was you doing at the time?
Yeah, I was at work, and I was watching TV, and this suddenly happened.
Okay. Do you have and who saw you at the time?
Yeah, my colleague.
Okay. And do you have any headache or dizziness or any symptoms before you have this fits?
No.
Okay. Do you feel that there is any neck stiffness, or there is any tinnitus or any fullness in your ear before this happened?
I have before that like vision problem before that.
No problem. And how long you take this fits?
Yeah, it's like 3 minutes.
Did you lose complete consciousness?
Yeah.
There was any slanting of upward of your eyes, or there is any foam from your mouth?
Yeah.
And did you wet or soil yourself?
Yeah.
Okay, when you get up, you are fully conscious, or you get up with some confusion and?
Yeah, I felt confused after that, like 5 or 10 minutes.
Okay. And do you have any weakness, any part of the body?
I felt numbness after that.
In which part of the body you feel numbness?
In right lower limb.
Right lower limb. Okay. Any weakness?
Yeah.
Do you have any chest? Okay. Do you have any rash on your body?
No.
Do you feel any chest pain, shortness of breath, or palpitation?
No.
Okay. Do you have any tummy pain, or do you have any lumps or bumps in your body?
No.
Do you have any water? Your urine, it is frequency and urine color is good, normal?
Yeah.
Any loose bowel, or there is a change of color of stool?
No.
Okay. And do you have any past medical history like high blood pressure or any other disease?
No.
Any past surgical history in the recent or past?
No.
Okay. And do you have any family history of the fits like you have, or any other disease that runs in your family?
No.
Okay. And do you have any allergies?
No.
Are you taking any medicines prescribed?
No.
Mhm. Do you smoke, drink alcohol, or by chance taking any illicit drug?
No, no.
What do you do for your living?
I'm a teacher.
And to whom, where do you live?
With my husband in downtown.
Okay, are you sexually active?
No.
Okay, and what do you think is going on with you?
I don't know, doctor. Do I need head imaging?
I respect your concerns, and let me know what is your major concern at the time.
Thank you,
Hello?
Dr. Tarek. Thank you.
Time finished?
Yes. Okay. I will give you 20 seconds.
Okay. Okay. What is your major concern?
Yeah, I am worried. Do I need head imaging?
Yeah. What you told me, there is a different causes of these fits, but what you told me and what I gathered your data, it looks like that you have epileptic fits, and this is from the brain, and you have this first time. For this reason, I will keep you under observation. I will do some your lab test, and I will do head image, your heart racing, and after that might be this is the five. There is a, because you have no any focal signs at this time, and I will call my neurologist and I will discuss. Might be you need imaging, but I think you need an observation, and for this is the first time. So I will take the consultation from the neurologist for this.
Okay, thank you. Thank you. Okay. Well done, Dr. Tarek. You are going step by step, and your approach is logic. Okay. And just try to accelerate your tone and try to concise your questions. I'm talking about the phrasing. Okay. No need to prolong the question itself. You can concise the question. Okay. It will help you to save time. Regarding the management plan, I appreciate your concern. According to your data, the most likely problem because of brain. Okay. So here, brain, heart, or what? The most important of that. Show the examiner that you are taking data to check is it CNS cause or cardiac cause. Okay. This is the most important. So what you need to do, examination, also some blood test. Also you will do head imaging because it's related to the brain. The patient has a vision problem before that, or headache, or anything related to neurology, and the patient has also numbness and weakness, so needs head imaging. I denied heart racing or chest pain, so it's not heart problem. Okay, well done. Okay, well, Dr. Abu Yahya. Dr. Abu Yahya.
Hello, Hani.
How are you?
I'm fine, thank you for that.
Okay. So we finished the whole approach. We will go for pediatric. Okay. So you have 30 seconds, Dr. Abu Yahya. You can start.
Hi, washing my hand and wearing PPEs. Hi, I'm Mohammed. I'm one of the senior doctors. Can you please confirm your name and your brother's date of birth?
Yeah, I'm Nadia. I'm 19 years. I came here with my brother. His name is Hatem. and he is 5 years.
Okay, thank you. Nice to meet you both. Is
7
your-
years or 5 years, okay. 5 years.
So brother, 5 years old. Okay. Nice to meet you both. Is anyone else? Is one of your parents is with you today?
No, my father at another hospital, he is sick, and my mother, she is caring about him.
Oh, I'm sorry to hear that. Is your brother is comfortable? I came here today to take some information about your brother complaint. That's okay.
Okay.
Okay. And staff nurse will be with us if we need anything. Is that okay?
Okay.
And you are happy for me to start?
Okay.
Can you tell me what's going on with your brother?
Yeah, today I was at home and I found him. He's going to pass urine and he's crying.
Oh, I'm sorry to hear that. So this is happening only today?
Yeah.
Did he complain of any tummy pain?
No.
And did he had any throwing up? Was he vomiting today?
No, no.
Did he had anything to eat or drink today?
Just he was passing urine and then he's crying.
And this happened one time or multiple times?
Today it was like 3 times.
Okay, I'm sorry to hear that. And any fever have you noticed?
Yeah, I check his temperature today. It's elevated. Yeah.
Oh, I will ask our staff nurse to get us some paracetamol. He doesn't have any allergy by any chance?
No.
We will get him paracetamol to try to relieve the fever. Is that okay?
Okay.
Did you notice or your parents notice any rash in his body?
Actually, I did not notice.
And is he having any diarrhea or any loose bowel motion?
No.
And any cough?
No.
Any shortness of breathing or fast breathing?
No.
Anyone sick in the family beside your father?
No.
Have he had this symptom before? The crying while weeing?
No.
And you said this happened today 3 times. Yesterday he was okay?
Yeah, yesterday he was okay.
Have you noticed or your mother noticed any discoloration in his genital area?
Do you think is it important?
It may be.
I did not notice.
Any fit or any seizure activity you've noticed?
No.
And does he has any medical problems at all?
No.
Do you know anything about his pregnancy? Was your mother okay during his pregnancy?
Yeah.
And he was born normal delivery?
Yeah.
Did he need any hospital admission after birth, or he was okay?
He was discharged at the same day.
Good, good to hear. And is he up to date with vaccination?
Yeah.
And you think that he is developing well? No problems?
Yeah.
And any family history of medical problems?
No.
Does he has any allergy?
No.
Does he take any medications?
No.
And who lives with you at home?
Yeah, me, father, mother, him only.
Does he goes to the nursery or reception?
Yeah.
And he was going in the last few days?
He's off today.
Any following up with the social services?
No.
Miss Nadia, is there any information you want to add?
Yeah, doctor, I found the urethral discharge and it's a full smell.
Okay, I'm sorry to hear that. This is today you've noticed that.
I don't know, but today I noticed that.
By any chance, is he circumcised?
Yeah.
And can you tell me any concern?
I am worried. What is the problem?
I appreciate your concern and appreciate
Thank
that,
you, Dr. Abu Yahya. Thank you. But you can continue 30 seconds.
I appreciate your concern. From what you tell me, yes, it's look like we have two problems at this point. It's look like he may be having a urine infection, and also there may be some condition it's happening to the males in the genital area. For that, I need to examine him with the staff nurse at the chaperone to look at the discharge and to look at the discoloration in his groin area, and do physical examination to his tummy, and we need to collect urine to test it for infection. We because of the fever, so we need to do some blood test. I'm sorry that we will take care of him. It won't hurt him. Just to know what is going on, and after doing all the examination and doing the urine test and the blood result, we will know more, and I will let you know what's going on. If that's okay.
Okay.
You have any question?
No, thank you, Dr. Abu Yahya. Okay. Here your communication skills, it's very good. You're asking by good way, okay, and simple way. But I'm worried about your tone. Okay, you have to accelerate your tone. I know we are practicing within 6 minutes, but you can accelerate at least slightly. Okay.
I need to ask two symptoms in the same sentences. I always ask one by one. Yes, this will make me hurry.
No, you are doing well. You are doing well, but I'm talking about the tone. You are doing very well. You are even question by question, it's good. Okay, but I'm talking about the tone. Okay. Yeah, you have to accelerate your tone, and also here you have to focus on the most relevant points. So here, what is the most relevant system, guys?
Genitourinary.
Genitourinary.
Genitourinary. Okay. So whatever a child or adult, the most important here, you have any urethral discharge. But because you ask me in would you like to add anything, I told you. But if you ask me from the start, it will be good. Okay. And also any pain, you ask me about tummy pain, any pain in genital areas. Okay. And also any skin changes or any ulcers in genital areas.
I asked, you said, is this relevant?
Yeah. I'm talking in general. Okay.
Oh.
Yeah. I know what did you ask and what you did not ask. I'm talking about everything in general. Okay.
Oh.
And yeah. Also here, maybe sexual abuse, maybe UTI. Okay. Maybe trauma. Did you ask me about trauma? Okay. So trauma, it's very, very important also. And here, the most important, you ask about the father, the mother, because it's unusual for a sister to bring his brother. Okay. It's unusual. So for a reason, why the examiner will give you station like that. So you have to ask about the father, mother, and you have to show empathy. Okay. Dr. Abu Yahya did very well about empathy, about safety, okay, and about giving management. He asked about comfortability of the patient, okay. He did very well. So here, my concern as a physician, maybe it's a urinary tract infection, maybe genital tract infection. So to rule out, guys, genital tract infection or sexual abuse, okay. So you have to ask any social services involved before, done by Dr. Abu Yahya. Also, you have to ask any carer for the child, any carer for Hatem. You have to ask any new visitor. Okay. Does Hatem talking with you with good eye contact? Okay, very, very important. Any bleeding in his underwear? Okay, I think these are the most missed points. Do you agree with me, Dr. Abuya?
Yes.
Yeah. Okay. So here you have to show the examiner by indirect way. You are searching, is it UTI or genital transmitted infection? Okay. And also the questions of social history here, very, very important. If she did not talk about father and mother, you can say, are your father and mother still in a stable relationship? Okay. Does your father or mother or you, by any chance, smoke, drink alcohol? Or sorry to say that, by any chance, use any illicit drugs? Very, very important in pediatric social history, guys. Clear, guys?
Yes.
Yeah. Maybe the mother, father divorced. So something wrong with this child, right? Maybe they are drinking or using illicit drugs. So it's very, very important. So do you or your father or mother, sorry to ask you, smoke or drink alcohol? No. Any of you, sorry to say that, by any chance, use any illicit drugs? And so on. So from the questions and from the answers, it will show you, is it going with which direction, which pathway, and so on. Okay. Well done, Dr. Abayah. Dr. Fayo?
Dr. Hani, I just want to ask a question.
Okay.
Regarding this case, for example, in the management, can we break down the sexual abuse, the differential diagnosis, to inform the sister of the boy?
If you feel it's very obvious for sexual history, you can mention that. Okay? But no need to talk about sexual history and you have no suspicion.
Okay.
For example, she said, I noticed the skin changes and the ulcers in genital areas. He has urethral discharge, and also he has poor eye contact. Okay? He is not talking. So you have to explore this information. Do you feel he's isolated? Do you feel when you are talking to him, he has poor eye contact? Clear, Dr. Abdul?
Okay. Yes, it's clear.
Okay. So once you feel it's a very suspicious for sexual abuse, you can mention that. Okay.
Okay. Thank you.
But no need to talk about this point if no suspicion. Okay.
Okay.
Yeah. So also maybe the father divorces the mother, maybe one of them is drinking alcohol, and also maybe they have social worker involved before, and. So anyway, the session will be clear with you. Okay, next one.
Okay, thank you.
Welcome. Next one, Dr. Fayo.
Hello, good evening, Dr. Hani.
Yeah. You have 30 seconds.
Okay.
You can start.
Okay. Wash my hands, work with PA. Hello, my name is Dr. Pio, ED Registrar. May I know your name and relation to the patient, please?
I'm Nadia. I'm 33. My son is 7 years. His name is Hatem.
Mrs. Nadia, nice to meet you. Do you want someone to attend with us?
No need.
Okay. Would you mind if a nurse attend with us as a chaperone?
Okay.
Okay. How can I help you regarding Hatem?
Yeah. Today I found him. He has shortened of breathing.
I'm sorry to hear about that. Where is he now? Is he okay?
Yeah, he's with your team now.
Okay, I need to check his vital signs and saturation too. Mrs. Nadir, your son is with the Safe Answer our team. Could you tell me more about the shortness of breath?
Yeah, 1 hour ago I found him. He's fighting for breathing, and I called the ambulance. They brought him here.
I'm sorry to hear about that. Does it happen suddenly or gradually?
Suddenly.
Okay. Does it affect his livings? I think it's happened 1 hour ago, right?
Yeah.
Is it worsening on the way here?
Yeah, it was worsening.
So it is continuous, right?
Yeah.
Did you notice anything makes it worse or better?
No idea.
Okay. Does he have a fast breathing or coughing?
Yeah, he was breathing fastly, and also I noticed noisy breathing.
Oh, I'm sorry to hear about that. This is the first time or any similar episode before?
First time.
Okay. Is there any temperature, night sweats?
No.
Any loss of weight or change in appetite?
No.
Okay. Any chest pain or did he say heart racing?
No.
Okay. Any headache or back or neck rigidity?
No.
Any jerky movements or eye sensitivity to light?
No.
Any weakness or paralysis in the body?
No.
Any skin changes or skin rashes? Did you notice?
No.
Okay. Is there any problems during the pregnancy of the baby?
No, it was normal.
Okay. Is there any problems during delivery?
No.
Any problems after delivery, like hospital admissions or anything like that?
No.
Okay. Is he growing normally? Development is okay?
Yeah, normal.
Okay. Is the immunization status up to date?
Yeah, up to date.
Okay. Did he have any medical problems that you know of?
No.
Any hospitalization before or any imaging done before?
No.
Any surgery done before?
No.
Did he on any prescribed medications?
No.
Any allergies?
No.
Any diseases runs in the family?
No.
Did he or you travel recently to anywhere?
No.
Did he have any contact with sick patients?
No.
Who did he live with and where did he live?
With me and his father.
Okay, where is your father? Where is the father of the baby?
He is on way now.
On his way. Or did he notify about the time condition?
Yeah.
Okay, is there any carers at home?
No.
Do you or your husband use drugs? Use smokes or drinks alcohol?
No. No.
Okay, by any chance, sorry to say that, did you use any illicit drugs?
No.
Any social services involved in caring of your child previously or currently?
No. No.
Okay, would you like to add anything regarding your son?
Yeah, this is the first time, and I'm worried. What is the problem?
Oh, yeah, I can understand that your concern is valid, and it might be frightening for you to see your son is having such kind of shortness of breath. So according to the data I collected from you, the most likely problem seems to be he's having an asthma attack, since he is having sudden onset shortness of breath with a noisy breathing and no temperature was noted. So to confirm the diagnosis, he needs to be kept in the observation room, and you can stay with him. And I will do the thorough physical examination, including the imaging, chest imaging, and heart rhythm. Also do the investigation that will involve inflammatory marker, full blood count, and the biochemistry also. After the diagnosis is confirmed, we can discuss about the detailed treatment plan. In the meantime, I will also discuss with the consult with the pediatrician about the assessment and management plan. Would that be okay with you?
Okay.
Do you understand so far?
Yeah. Thank you. Thank you, Dr. Fahim. What do you think, guys?
Okay.
I believe this is station about explanation, or get confused or what.
Okay, what do you think about
very good
the
performance.
approach? What do you think?
Super approach, really.
Okay, for me, you are fantastic, Dr. Fahim.
Thank you, Dr. Hani.
Yeah, really. Okay, so I just want you to formulate the management plan. So here, what is the diagnosis?
I think asthma.
Asthma.
Because
okay,
yeah.
Here, data, guys. When you are taking data, I'm talking about history taking. So you are not reaching diagnosis, but you are reaching most likely diagnosis. Okay, so according to your data, the most likely problem is constriction of airway passages, which is called asthma. And it's likely in his age. Okay, you already rolled out infection. You already rolled out allergy. I told you no allergies. Also, I wish if you ask any lip or tongue swelling, okay, is this happen after eating or taking medicine? Okay, to roll out anaphylaxis. Okay, because sudden.
Yeah.
Did you notice any foreign body in his mouth? Okay, any sudden onset? Think about foreign body. Think about anaphylaxis or allergy. Think about asthma also. Okay, so most likely problem according to your data may be constriction in the airway passages, which is called asthma. Okay, you summarized very well. You said no temperature and no. So you are confirming by summarizing. Okay, this is a good communication skills also. Okay. What we are gonna do now, we will examine him. Here, you need chest imaging or not? In asthma, no need for chest imaging until it's life-threatening. And I did not examine him yet. So you can say like that. We will examine him. We will give him a nebulization or nebulizer to dilate his airway passages. Okay. And some oxygen. Okay. And in the meanwhile, we'll do a blood test. Okay. According to the examination, we will see if he need chest imaging or not, or you can say chest X-ray or not. Okay. So give possibilities only, not give a sure investigation. Okay, guys? Yeah. Well done. Next one.
Thank you.
Dr. Sameh. Yeah.
Can you escape me to the next one?
Okay, no worries. Okay.
Bring my son. next one.
Dr. Ahmed Al-Amin?
Yes, Dr. Hani.
Yeah, because Dr. Samah, he has a child. You can do the next one.
Okay.
You can start.
Okay, I'm going to wash my hand, put on my PPE. Hello, I'm Dr. Ahmed Al-Amin, ED registrar. May I confirm your name and relation to the child, please?
Yeah, I am Nadia. I have my child Hatem. He's 10 months.
Nice to meet you, ma'am. Today I've been asked to take some data from you. Someone is speaking. Today I've been asked to take some data from you. Would that be okay?
Okay.
Okay, is your child comfortable right now?
No.
Okay, I've been informed that he's having shortness of breath. Is this correct?
Yeah.
Okay, so let us shift him to the resuscitation area. Our team will take care of him. We're going to check his saturation as well as his vital sign, connect him to a monitor and give him oxygen if needed, okay?
Okay.
So your child is in safe hands now. I would like to take some data from
Thank you.
One of the nurses will be attending with us, okay?
Okay, thank you.
Okay, so Mrs. Nadia, can you tell me exactly what happened to your child?
Yeah, you know, he has 3 or 4 days flu symptoms, runny nose, cough, and today suddenly he had severe shortness of breath, doctor. I'm really worried. What about him now?
Don't worry, ma'am. He's in safe hands now. We are giving him medication and he will be fine. Just I need to take some data from you. Okay. You told me for how many days he's having that? 4 days?
Yeah.
Okay. Did it start suddenly or gradually, ma'am?
Gradually.
Okay. Since the beginning, is it getting worse, improving, or was it the same?
Worsening.
Is it on and off or continuous?
Continuous.
Has it ever had happened to him before?
No.
You think of anything that was making it better or anything that was worsening it?
No idea, doctor.
Okay, Mrs. Nadia, was Hatem suffering from any cough or chest wheezes with the flu symptoms you told me about?
Yeah, flu symptoms of 4 days, and today he has severe shortness of breath.
I see. Did you feel that his heart was pumping strongly?
I did not notice.
Okay, was he suffering also with the flu symptoms of fever or night sweats?
Yeah, flu symptoms.
Okay, what about his appetite and weight recently? Are they okay?
No, I felt he has poor feeding, and also he has fast breathing.
Oh, I'm so sorry for that. So, Ms. Nadia, did you notice that your child is having any stiffness in the neck or any jerky abnormal movements in his body?
No.
Was he injured anyway, or you felt that he's weak, or I see. Was he throwing up, or you felt that he's having gases in his tummy or having tummy pain?
No.
Any urinary troubles he was having?
No.
Amount of urine was normal?
Normal, yeah.
Okay. Mrs. Nadia, regarding the pregnancy of the child, was it a normal pregnancy and delivery?
Yeah.
Was his weight normal?
According to his age, yeah.
Yes. Was he admitted to the hospital after birth?
No.
Is his immunization up to date and his growth and development normal?
Normal, yeah.
Okay. Was he diagnosed before with any medical problems?
No.
Any hospital admissions before or any surgeries?
No.
Was he diagnosed to have any allergies?
No.
Did he did you travel recently anywhere?
No.
Any disease that run in the family?
No.
Okay, Miss Nadia, is there any carer for Hatem?
Me and his father.
I see. Where do you live?
In downtown.
Sorry for the question. Anyone around Hatem is smoking, drinking alcohol, or by any chance taking any illicit drugs?
No.
Do you have any other children at home?
Yeah.
Are they fine?
Yeah, okay.
Okay, sorry for this question. Was the social services ever involved regarding Hatem or any other children?
No, no.
Okay, so can you tell me, is there anything you wish to add for me you think it is of importance regarding his health?
Nothing, but I'm worried about his shortness of breath. I don't know what is the problem. Is it asthma?
Okay, your concern is appreciated, ma'am. However, it is not asthma. This is a condition which happens to children below the age of 2 years old, which we call it bronchiolitis. It's a kind of inflammation of the small airways and accumulation of secretions there. So in order to confirm diagnosis, I need to keep him in observation room. I'm going to do a full examination for him, including his chest and his heart. Also, I might need to do some tests for him, including blood hematology, blood biochemistry, as well as blood gases. And we may need to do a chest X-ray for him. At the time being, we are going to do suctioning from his nose and his throat to clear the secretion and put him on oxygen. You told me that he has poor feeding, and this is indication that it might be a severe form of the disease. So we might have to admit him to the hospital after consultation of the pediatric pulmonologist. Okay, this management plan sounds reasonable for
Thank you, Dr. Ahmed. Thank you. Okay. Amazing. Well done. But I need you to check understanding in the management plan. Okay.
Yes.
Yeah. So give me piece by piece. So is that clear with you? You have to ask and check understanding each time. Okay. So
yes.
According to your data, the most likely problem, and according to his age in months, so maybe, as you said, but I wish if you explain the disease after that, which is called bronchiolitis. Okay.
Yes.
For example, blood clots in the lung vessel, so which is called pulmonary embolism. I wish to mention the disease after explanation. Okay. Okay. Yeah. And is that clear? Did you understand? Only 1 second or 2 seconds. It will not waste your time. Don't worry. But at least here you are giving information in this. If you feel you are talking too much, stop. Okay. And then check understand. Clear?
Okay, Doctor.
Yeah. But amazing. You are doing very well, mashallah. Okay. So here the patient 10 months, you have to rule out infection. Pneumonia, it's unlikely. Less than 2 years, it's unlikely to be pneumonia. But at least you have to rule out high temperature. It will be mild temperature. Bronchiolitis, it will be mild. Maybe 37.5, 0.8, something like that. Anyway, flu symptoms that will confirm. Here, maybe she will ask you, would you give him antibiotic or nebulizer? What do you think, Dr. Ahmed?
No antibiotic or nebulizer. I said only it will be suctioning for the nose and for the mouth for the secretion and applying oxygen for him.
I am the mother now.
Yes.
I want to
no, he doesn't.
I want to test your skills,
okay.
communication skill.
Okay.
Would you give doctor? Would you give him nebulizer or antibiotic?
No, actually, ma'am, regarding the antibiotic, this is a viral infection, so antibiotic will not be effective at all with him. As well as the nebulizer, these are secretions, so it is not a narrowing of the airways, and the nebulizer will not have an effect on him. So the best thing to do for him now is to do the suctioning and keep him on oxygen.
Okay, thank you. Well done.
Thank you.
Okay, welcome, doctor. Well done. Okay, Dr. Abdul Latif.
Dr. Shani, just one question before we proceed. I'll be ready after Dr. Abdul Latif. Regarding this kind of station, mother with the son or mother with someone, sister with someone. In this station, it will be history for sure. Some presentation, some complaint. We need to firstly take care if that one his complaint is safe or firstly, then we'll proceed to the history like that. So,
yeah, sure.
Any patient. Any patient. This is my okay.
Yeah. Any patient.
He just I have one scenario in my mind. He will be taken care by my team, and I came to collect history, or he is accompanied with his co-patient? This is my question.
Yeah. In general, adult or pediatric, guys, adult or pediatric, the symptoms, serious symptoms, for example, heart racing, shortness of breath, or bleeding, you have to address that before taking that. Okay? So, in pediatric particularly, you have to send the patient to your team, and they will take care about the child. Okay, and then you will take data from the relative. Is that clear, Dr. Sameh?
I no need to mention the modality of treatment that we give to him.
No. They are not testing. They are not testing your knowledge. They are testing your skills.
Just we put your ex son in resuscitation room. He will be taken by our team. Then I need to take some data like that.
Yeah, excellent. So fixes that in all pediatric.
Okay.
I want to reassure you, your son Hatem is with our team now in safe hands. They are examining him and they are taking care about him. Is that okay with you? Yeah. I need to take some data regarding his condition. Is that okay with you? Yeah. Clear, Dr. Sameh?
Very clear, Dr. Hani. Very clear.
Yeah. Okay. Well done.
Thank you.
Welcome. Doctor, you want Dr. Sameh? This is your turn, Dr. Sameh.
No problem, Doctor. If I will be after the next one, no problem. No worry, Doctor.
Okay. Dr. Abdul Latif?
Yes, can I add something, Hani?
Yeah.
It's always in pediatric even the resuscitation room for pediatric patients, the family, mother or father or anyone accompanying them, it will be in front of them. So the child is in front of them. We're connecting the monitor in front of them, and we taking the history while we're doing that. So
yeah,
the child, it's not somewhere else. We are in the same room, whether it's normal cubicle or it's a monitor cubicle or resuscitation. So we're taking the history while, so the team, you will mention that we are looking after him, we are connecting the monitor and giving him medication. He's in front of us, the child is in front of us, and we're taking the history at the same time. So it's all together. So that's why you don't get confused about this. We always manage the pediatric in the same with the parent, even if it's resuscitation, parent will be accompanying the child.
Yeah, well done. Okay, Dr. Abdul Latif?
Yes.
Okay, you have 30 seconds. Okay, you can start.
Good morning. My name is Dr. Abdul Latif Ali, the registrar. May I know your name and age and your relation to the child, please?
Yeah, I am Nadia. Hatem is 18 months.
Nice to meet you, Ms. Nadia. Nadia, I think you are here because Hatem has some problem. So could you tell me what Hatem have?
Yeah, he is limping, doctor.
Okay. Okay. Is he comfortable now?
No, he's not okay. He's limping.
Okay. Do you want me to give him any painkiller?
Yeah, I give him painkiller. I asked his doctor and he gave him painkiller, but he's not responding.
Okay, okay. So can you tell me a bit more about his limping?
Yeah, you know, I found that the other day he's limping on the right leg, and today it's increasing.
Okay, sorry to hear that. Do you notice any swelling in his leg?
No swelling.
Okay, okay, it's increasing. Any redness on any?
No redness.
Okay. Does Hatim start walking?
No, he is limping, doctor.
Yeah, I mean, before this limping, does he walk normally?
Yeah, yeah.
Yeah, okay. And so now he's not even bear weight on his right leg.
Yeah, yeah.
Okay. 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 So this start yesterday, you said.
The other day.
Okay, the other day. So does he fall down or has any trauma?
No, no.
Do you think he has any? Does he cry or has headache or anything? Do you think?
No.
Okay. So is there any weakness in his leg?
I don't know.
Okay.
You know, he's 18 months.
Okay. How about his temperature? Is he has high temperature?
No, no. Yeah,
Does
I remember 3 or 4 days he has flu symptoms, fever, and also you know, runny nose, cough, sneezing. But I give him paracetamol. Today he has no fever.
Okay. Does he eat normally now?
Again?
Does he eat normally?
Yeah, yeah.
Okay. So does he have any other symptoms?
No.
Okay. Okay. During your pregnancy with Hatim, did you take any medication or did you have any medical problem?
No.
Was he delivered normally?
Yeah.
Any admission after his delivery?
No, no.
Okay. Is his development okay?
Yeah.
Is his immunization up to date?
Up to date, yeah.
Okay. Any medical disease in your family?
No.
Any previous surgery for Hatim?
No.
Any allergy?
No, no.
Okay. Where Hatim live?
He's living in downtown with me and his father.
Okay. Any other children at home?
Yeah, yeah.
Are all of them okay?
Yeah. Okay.
Anyone at home smoke, drink alcohol, or by any chance use any illicit drug?
No, no.
Okay. Are the social services involved in Hatim condition?
You mean before?
Yeah.
No, no.
Okay. Okay. So do you want to add anything related to Hatim problem?
Yeah, doctor, I want to do X-ray for him. I'm really worried.
Okay, your concern is genuine. The most likely problem of Hatim is the inflammation of his joint, which follows the infections that he had, as you said.
Which joint, doctor? Which joint?
You said in his right leg. Most
Yeah.
probably the knee. Okay.
Which joint?
The right knee or hip. But most probably right knee.
I found he has a problem in his hip, right hip.
Yes.
Right
maybe.
side.
Yeah. Maybe his right hip or his right knee, because just he's limping.
If I'm touching the right side hip, he's crying.
Yeah. So it most probably due to the inflammation of his right hip. But we of course we need to exclude other causes. So for that.
Thank you, Dr. Abdulatif. Okay, I will give you 20 seconds.
What is your concern?
Yeah, I want to do X-ray for him.
Yes, as I said to you, his he had inflammation in his right hip. This is inflammation post infections that he had before. So, and this is self-limiting condition. We call it transient synovitis. So it might take 3 to 2 weeks, but to rule any other condition, we need to keep him in observation, and we'll do some blood test, and we'll do infection screening, and we will consult the pediatrician, and we might, but to be honest, we don't want to do any radiation for him, because I think he don't need anything. But after that, I will discuss all this issue with you after the result of investigation. Is that okay with you?
But I need to do X-ray, doctor. I am really worried.
I can understand that, but for safety of Hatim, there is no need for X-ray meanwhile, okay? Because this is common in his age, and it is not involve the bone or the joint itself. This is inflammation.
Excellent. Thank you, Dr. Abdelatif. Okay. Who want to communicate with me regarding this conflict, guys? 20 seconds.
Yes, Dr. Hani.
Can you tell me why do you need an X-ray for him?
Okay, so Dr. Abu Yahya, you can communicate with me for 20 seconds, please.
Yeah. Can you tell me why do you want an X-ray for him?
Yeah, I'm really worried, doctor. I don't know. Is it fracture? Is it you know, my cousin, he has same problem before, and is he diagnosed with Burns disease?
Oh, I'm sorry to hear about the cousin, and I appreciate your concern, but you know that your son is 18 months old. The Burns disease, what you mentioned, is usually happen in the age between 3 to 10 years old. It's unlikely to happen in 18 months. In 18 months, it's usually due to viral infection, and it's self-limiting. So the X-ray, it doesn't change the management at all. It's don't add anything to the management because it's self-limiting. It will take time and it will resolve by itself. And it's a radiation to the child, and we don't want to give him radiation, and it's not adding anything to the management.
So maybe fracture, maybe fracture. I don't know if he fell down or not. I don't know.
I appreciate your concern, and it is, I know it's very worrying that your child is 18 months and is limping, but usually even with the fall in young age, their bone is resilient, and they don't break that easy like in adults. And as I mentioned, because it's self-limiting, the X-ray, it doesn't add any new information for the management, and it's a dose of radiation. You have to think about the future because it's harmful for him, and it's not adding anything for us to for the management. Usually the management is self-limiting, and sometimes we can do just we can support the hip with a support, but it doesn't, we don't, the X-ray doesn't show, it won't tell us anything more than we already know.
Okay, thank you, Dr. Abu Yahya.
Dr. Hani?
Yeah.
Dr. He is good, but one thing he can add that only I will take second opinion.
You or she?
No, he has to ask you that, okay, if you are insisting, I will talk to my senior and I will take up a second opinion for the X-ray.
For me, I don't agree. I
will say that at the time we don't need an X-ray for him, but however, we will do examination for him. If we have any doubt that he might be having any problem that need an X-ray, we will do it.
Yes, but why you will depend on examination? You are taking history taking, okay, and they will give you marks for exploration data, right? If they want you to examine the patient, they will ask you examine the patient, right?
I think so, Dr. Hani. We have to stick with our what you say approach, And we have to stand firm that X-ray is not indicated at all. So we will only give a conservative management.
Okay, let me to give you a clear idea. So here, any conflict, guys, any conflict, explore more and more and more. Okay, so what will I say? I appreciate your concern, but can you tell me more why you are worried? I'm worried. Maybe it's a fracture, maybe it's a burst disease. So why do you think it's a fracture? Why do you think it's a burst disease? Okay, because my nephew or she has the same problem and. Okay, I'm sorry to hear that. What about her now? Is she okay? Yeah, she's okay. Nice. So regarding birth disease, it's unlikely in this age, and it will be 4 to 10 years. And also, as you said, according to your data, he has flu symptoms, and most likely will be viral. And this going with a diagnosis of inflammation of the joint, which is called tenosynovitis. Okay. And regarding the fracture, here Dr. Abdul Latif did not explore well regarding the fracture. Okay. He did not do analysis of the local symptom. What is the most relevant system here, guys?
Musculoskeletal.
Musculoskeletal and
Neurology.
CNS. Musculoskeletal number 1, number 2 CNS. Okay, so here musculoskeletal, the patient, even he is not walking, even they will give you age of 5 months or 10 months. So fixes that. Do you feel that he is moving? I don't want to say walking. Did you notice that he is moving all limbs? Okay, so he's moving or not, number 1. And also moving here, it means no weakness, no paralysis. And regarding trauma, does he have any recent trauma? Okay, so after that, did he lose his consciousness? Because maybe he has neurological disease. That's why he cannot move this limb. Okay, did he lose his consciousness? Any vision problem? Okay, and also do analysis for the limb. So where is the pain? Is it painful? So maybe limbing without pain. Is it painful? Okay. The problem in the right limb or left limb, on both limbs. If in the right, in the hip, knee, or ankle. So if you explore too much, it will give you idea. Also, any swelling, any redness, Dr. Abdul Latif asked about 50% of questions. So you have to ask about analysis of the complaint. Okay, so start by musculoskeletal system. After that, CNS and the BNS, it will be easy for you to catch the station. Because if you will say in the end, according to your data, it's unlikely for trauma. The examiner will understand that you ask already, but you did not ask about this question. It's not logic to tell here it's unlikely. Okay, clear, guys? So you have to do analysis from the start. Okay, so for example, if the patient had back pain, and she want to do X-ray, you have to ask her questions for coda equina. How? No need to say it will be radiation. Radiation here, it's not logic reason. It's not logic reason to not do. If the patient has fracture, you will do X-ray or not?
Yeah, for sure.
We will do, sure.
We will do. why you don't care about radiation here? Because there is a indication for history taking. I'm not talking about I will examine the patient. Here they will give you marks for exploring data. Did you get my point, guys? Okay. So we have one station, leg pain and the back pain in communication. We will discuss that later. The patient want to do workup, but your colleague, he refused. And she came to you for second opinion. So how to convince her no need for X-ray? You have to ask her questions. Do you have trauma? No. Do you have pain or weakness or paralysis in your legs? No. Do you have night sweats, loss of weight or appetite? No. So she has no answer for malignancy, no answer for trauma, no answer for infection. So why you will do imaging for her back pain? What is your concern? I am worried. Maybe it's a malignancy in my back. So let me ask you some questions to check if you have something serious in your back or not. We will discuss that in details in communication, guys. But at the moment, if you will go step by step, everything will be clear with you. Okay. Next one, guys.
Yes, okay.
Okay. The last one, Dr. Amjad.
Don't forget about me, Dr. Amir.
Oh, Dr. Sameh. Yes. Okay. Okay. So only one comment in the previous station. I have good news. Always use user communication skills. After you convince her that it's not birth disease, it's not trauma, I have good news for you. This inflammation, it's a self-limiting. Here, no need to consult a pediatrician or anything. Just give painkiller, and you have to come back if the symptoms not responding or not relieving. So give just leaflet only. No need to consult anyone at the moment. Okay. Dr. Sameh?
Yes, Dr. Hamid.
You have 30 seconds. You can start.
Yes, the door. Hello, I'm Dr. Samih. I'm an emergency physician. May I know your name and your relation to, I don't know the name, and how I can help you today?
Yeah, my son Hatem, he's 7 years. He has rash.
I'm sorry to hear that. Is he okay now?
Yeah, he's playing now.
Okay, nice. Mrs. Nadia, I need to take some information from you regarding Hatem. This is okay with you?
Okay, okay.
Can you tell me more about his rash?
Yeah, this one started the other day. It's it's increasing, and today it's too much. I found in his lower limbs, and I searched on the internet. I found one of the reason of rashes like something like meningococcal septicemia, something like that. I'm really worried.
I appreciate your concern, Ms. Nadia, and we will go, inshallah. I'll explain for you everything. Later. Then about this rash, is it in other place apart from his lower limb?
I check in his lower limbs in the posterior aspect and in his buttock.
That the area of rash. This rash starting from yesterday till now, it is progressing or same, not increasing?
Worsening.
It's worsening, get more spread.
Yeah.
Is this rash associated with any itching or changing skin color?
Yeah, not itching, but it's a different size of rash.
Of rash. Okay, I get that. Okay, then is this rash accompanied with your son have a high fever with this rash, or he have any night sweat?
No,
Did you not notice any lump in his body, any losses, if appetite or any loss of his weight?
no, no.
Did he has any tummy pain or feel sick recently?
Yeah, he has the few days back, 3 or 4 days, he has flu symptoms, you know?
Can you tell me more about this flu symptom?
Yeah, runny nose, cough, and also mild temperature.
I'm sorry to hear that. Did you seek any medical advice for this flu symptom? Did he receive any kind of medicine?
Yeah. I give him medicine. Uh, no flu symptoms, but I found this is rash. I don't know what. Is it because of the medicine?
We'll go through that. We'll go through that in a minute, inshallah. Then did he is having any throwing out, any vomiting?
No, no.
Okay. Any change in the urine color and any change in the urine frequency recently?
Yeah, today I found this urine dark red, and also, I found like I don't know blood in the stool or not.
I'm sorry to hear that. This is since today.
Yeah.
Did he have any shortness of breath, any wheezing,
No,
any cough?
no.
Did he suffering from any headache, any jerky movement, or vision problem recently?
No.
No. Okay, then did I'm asking some question regarding his development. Is it okay with you?
Okay.
Is his pregnancy going very well with you?
Yeah, his pregnancy was okay.
And his labor is normal labor. How you give birth to him?
It was okay.
Did he was admitted after labor to any to ICU or anything, or he discharged with you home?
We went to home in the same day.
Nice, very good. And how his development? He's developing good according to his age. He's gaining weight very good.
Okay.
And what about his ammunition? His ammunition is fully up to date.
Yeah.
Okay. And also I need to ask, did he was diagnosed by any medical problem before?
No.
Did there is any past medical, there is any past surgical operation for him?
No.
Did he take any medicine recently?
No.
Did he have allergy to any kind of medicine or food?
No.
And any disease running in your family or
No.
his father family?
No.
I need to ask some questions. Just where you are living?
In downtown with my husband.
And may I know what are you doing for live?
Thank you, Dr. Sam.
Thank you.
Okay. Well done, but I am worried about your tone. You need to accelerate your tone.
Okay.
Yeah. You are going in systematic approach. Okay. But here the tone. Okay. Yeah.
Okay.
I will give you 20 seconds from differential diagnosis and management.
Okay. May I know your concern, Ms. Nadia?
I'm worried, doctor. Is it something serious? Does he need any imaging?
I appreciate your concern, and I have a good news for you from what you are giving us, the data you are giving me. this is one kind of inflammatory reaction that coming after the flow symptom. We call it idiopathic thrombocytopenic purpura. And this, I mean, this some inflammatory reaction lead to destroy of some blood cells, but it is self-limited, takes some time, and no need for any worry about that. But meanwhile, we need to keep him in observation area, do some physical examination for him, and I need to run some blood tests for him, like full blood count, and I go for him urine analysis and liver function test, renal function test.
So he will go home?
After we need to keep him here with us for observation until we reach the definitive diagnosis, as I told you.
Yeah, if confirm diagnosis, we will go home.
If we confirm this idiopathic thrombocytopenic purpura, you mean? No.
Yeah. So if confirm diagnosis, what will we do?
If we confirm his diagnosis, we need to consult his pediatrician, and we will.
Okay, thank you, Dr. Sam. Okay. Yeah. So what is the most likely problem, guys? Okay. So how to diagnose ITP?
Symptom and blood test.
If there is any bleeding, ITP. If no bleeding, not ITP.
Rash with bleeding.
Okay. So this patient, if Hirschenline purpura, you will discharge according to the data, guys. You will discharge or you will admit.
No, he's showing complications. He needs admission.
Okay. So if the patient has dark urine, most likely hematuria, right?
Yes.
Yes.
If dark stool or blood in stool, so what is the most likely problem? What is the most likely complication? Intussusception. Okay. So you have to do urine analysis, kidney functions, and stool analysis, and the tummy scan also, right? Okay. So to rule out intussusception, according to the workup, according to the results, and according to the examination, you will see if you will admit the patient or discharge the patient. But most likely will be admission. You have to tell the patient like that. Most likely, according to the data, most likely will be admission. But you have to rule out hematuria, kidney impairment or injury, and so on. Clear, guys?
Yes, Dr.
Yeah. Okay. Next one, Dr. Amjad.
Yes, Dr. Hani, how are you?
Yeah, welcome. You have 30 seconds. You can start.
Okay. Good morning. I'm Dr. Amjad, ED registrar. May I know your name and relationship to the patient, please?
Yeah, I am Nadia. My son had him 3 weeks, and he has vomiting for 3 weeks.
Oh, I'm sorry to hear that. I'm sorry to hear that. Do you think he is in pain or in any way uncomfortable?
I don't know.
Okay. So, can you tell me more about this vomiting?
Yeah, since birth, 3 weeks now, each time I will feed him, he will vomit.
Oh, so he's vomiting since birth for 3 weeks. And there is any blood with the vomiting?
No, no, only the feeding only.
Okay, okay. And how this vomiting occur after each feeding, or sometimes?
After each feeding.
Each feeding. Okay. And what it was since birth, is it the same or worsening, or do you think it's improving?
Worsening.
Okay, okay. Do you think anything makes it worse, like makes it worse or makes it better?
No idea, doctor.
Okay, okay. And do you feel like he's crying when he's vomiting, like maybe he has a tummy pain?
No idea.
No idea. Okay. Any diarrhea?
No.
Okay, okay. Okay. Have you noticed anything abnormal with his urine?
He has decreased the amount of urine.
Okay, I see that. Okay. Any skin rash?
No.
Okay. Any high temperature?
No.
Okay. Any change of appetite?
No.
Okay. And have you noticed like any jerky movements or loss of consciousness?
No.
Okay. Have you noticed any weakness in his limbs?
How I know he has weakness, doctor?
I mean, have you noticed like his floppy or like his?
No, no, no.
Okay, okay, thank you. And I would like to ask about your pregnancy. Was your pregnancy like? Do you have any medical problems during pregnancy?
No, normal.
Okay. What about the delivery? What was the gestational age?
He was on time.
Okay. And what about his birth weight?
Normal.
Okay. And after birth, you notice any other problems aside from this vomiting?
Normal.
Normal, okay. Did he receive any immunization?
He's 3 weeks, doctor.
Okay. So he has no other past medical diseases?
No, no.
No, okay. And delivery was normal, or was it by surgery?
Yeah.
Okay. Okay. And is he using any medications?
I give him medicine for vomiting, but no benefit.
He's still vomiting. Okay, I see. Okay. And have you any allergies, non-allergies?
No.
Okay. Where do you live? Where do you live and with whom?
With me and with my husband in downtown.
I see. And do you smoke or drink alcohol, you or your husband?
No, no.
Okay. By any chance, any of you use any illicit drugs?
No.
Okay. Any other carer for the infant?
No.
Okay. Okay, I can see. So, Miss Nadia, your son is Hatim is 3 weeks and he's vomiting since birth. Do you have anything else you would like to add? Maybe I missed in the history.
No, but I am worried, doctor. What is the problem?
Okay, so I appreciate your worry. And according to the data I just gathered from you, Hatim most probably has some enlargement of one part of his intestine. This we call it hypertrophic pyloric stenosis. But we have to rule other causes as well. So we are going to need him to keep him in the pediatric observation area, in the unit, in the observation area, do some the blood tests and do
Thank
some
you.
scan.
Thank you.
Okay.
Thank you.
Thank you.
Okay, I will give you 20 seconds.
Okay, thank you, Dr. Han. So we'll keep him in the observation area and do some blood tests like electrolytes and blood and biochemistry. We'll do also tummy scan to know the exact cause of his illness. Is that okay with you?
Okay.
Okay. Do you have any further questions?
So we will go home now?
No, we have to keep him in the observation area. We'll do the blood test and the scan, and we will involve a senior pediatrician. And if the diagnosis is confirmed, he may gonna need to have surgery to dilate that part. I
remember I have diabetes. Is that related to this problem?
Okay, so I don't think it's related to this problem. David may have some other issues. We're going to check his blood glucose with the other test. Any other questions?
No, thank you.
Okay, thank you. Nice to meet you.
Okay. Well done, Dr. Amjad. Guys, this station, I asked the mother in the exam, any disease run in your family? She said, I have diabetes. Do you think, is it related, guys?
She's microsomian.
No.
No.
No,
No.
I don't think.
No.
What do you think, guys? Why she said in the exam she has diabetes?
Yeah, it can be like you have to rule out diabetes for the baby too, along with hypertrophic.
Excellent. So I asked the examiner, I want to check the blood sugar of the baby. He said normal. So just a distraction, right?
Yes.
Yeah.
Okay. So I inform the mother. We need to rule out other problem, maybe milk intolerance, right? So don't be scripted. Don't say it's hypertrophic pyloric stenosis. You have to mention this likely problem, okay? But we need to rule out other problems like milk intolerance and okay.
If it is projectile, Dr. Had,
Yeah, he did not ask about the character, okay? So you have to check the vomiting. Is this vomiting associated with blood? Is this vomiting? What is the color of vomiting? Okay, so if bile stained or not, bilious or not, okay? And also for regarding the distance, do you find the vomiting like 1 meter or 2 meters away, or vomiting on his chest? Clear, guys? So projectile or not, okay? So anyway, you will do tummy scan, you will do blood test, including football count and kidney and electrolytes, and also blood gases. And after that tummy scan, if confirmed it's hypertrophic pyloric stenosis, you have to inform her also before mention the diagnosis. It's here thickening of the wall between the esophagus or food pipe and the stomach, okay, the canal. So the food not passing to the stomach. That's why he's vomiting. So you have to do surgery and mention to her if confirmed the patient will be admitted for surgery. Okay.
Sickening from the stomach and the small intestine. Not the food pipe.
Yeah, between the food pipe and the stomach.
This achalasia, Doctor.
Yes, after stomach.
After stomach and small intestine.
Yeah.
Yeah. So anyway, you have to mention by simple way to the actor. Okay, well done, guys.
Or we can say like gastric outlet obstruction, like something like that.
Yeah. Okay.
Doctor, regarding this particular hypertrophic pyloric stenosis,
Yeah.
can we ask in the history for the abdominal masses?
Yeah. Did you notice
Yes,
any swelling in the tummy? Okay. So she denied. I asked her, she denied. Okay. Next one, Dr. Nasser. Dr. Nasser.
Yes, yes, Dr. Han.
Yeah. How are you?
Fine.
You have 30 seconds. You can start.
Hello, I'm Dr. Nasser, ED Registrar on duty. May I know your name and relation to Hatem, please?
Yeah, I am Khalid. I'm his father.
How's old he, Hatem?
4 years.
Okay. Nice to meet you, Hatem. How I can help you today?
Yeah, I found Hatem his not okay. He has abnormal behavior.
Sorry to hear about that. Anyone attend with you?
No, only me.
Okay. And would you mind if our staff nurse attend with us?
Where is he now? He's okay.
Okay,
I
now.
want to see him. I want to see him, please.
Okay, Hatem is a safe hand with our staff, and I will inform you about all issue. First, you can invite you to sit in private room and have a seat, please.
Okay.
Okay. What do you know so far about Hatem, Mr. Khalid?
Yeah, today I went home. I'm divorced with his mother, and I want to visit him in the morning. I found him not listening to me. I'm talking to him. He's not looking at me. I found something wrong with him.
Sorry to hear about that. You saw him this morning? How? When?
Yeah, 1 hour ago.
When? 1 hour ago. And since you saw him, his condition is improving or progressing or same?
Worsen.
Do you notice any abnormal movement, jerk movement?
No.
Do you notice there is a loss of conscious or paralysis?
No.
Do you notice any injury, head injury, or before the?
No.
Mr. Khalid, if you don't mind, I'll ask you about question. After you found him, his any weakness?
Yeah, I found him like floppy. Yeah.
Floppy. Okay. His good eye contact with you?
No, he's not looking at me.
Yes. Okay. Did he lost his, he wet himself or soiled himself?
No.
Do you feel any high temperature or?
No.
Skin changes?
No.
Do you feel any lump on his body?
No.
There is any weight loss recently?
No, no.
He is throwing up or feeling sick?
No.
What about his bowel work?
It's okay.
Do you feel any chest pain, heart racing? His heart is racing?
Yeah, I found his heart is racing. Yeah.
Okay. There is any difficult to breathe?
No.
Regarding his pregnancy, it is planned pregnancy?
Yeah, yeah.
It is his pregnancy passed uneventfully?
It was normal.
What about the delivery? Is delivery normal at term?
It was normal.
Okay. He is developing like others?
Yeah.
Is immunized up to date?
Yeah, yeah.
There is any past medical history of concern?
No.
Any surgical history?
No.
I want to ask you a specific question. With whom he is living and where? You told me it was his mother, huh?
Yeah, yeah.
And there is any carer?
No.
Is you or mothers or any our partner smoking or drink alcohol or by any chance?
No, no.
Smoking or drinking alcohol?
You know, I heard her partner is drinking alcohol and also using illicit drugs.
Sorry for that.
Thank you, Dr. Nasser. I will give you 20 seconds.
Okay. What's your concern and what's your?
I'm worried. He's okay now.
Don't worry. Hatem is safe hand. We'll investigate. We'll do for him full clinical examination and run some blood tests. We have a concern. It may be exposed to this alcohol or illicit drug that your wife, his mother and partner using. And we need to contact social workers and we need to see all other siblings living with the mother.
Yeah.
And we'll update you about all issue after full.
Okay. Thank you. Thank you,
Okay,
Doctor. Yes. Okay.
هو
Thank you.
approach أنا first start دبارة بعدين فكرت إنه
It's up to you. It's up to you. If you will use Odebara or Who approach, both of them will help. Okay. So for me, if I will use Who approach, here already he told you he was at home and he is the witness. Okay. So you can repeat. So you are the one. So Hatem in this condition. Yeah. And this happened at home. Yeah. So this, you can continue questions. Can you tell me when did that happen? I'm using Who approach now. Can you tell me did that happen 1 hour ago? And here, how many times in the past 6 months? It's the first time or maybe the second time. Okay. Here, why do you think the reason behind that? Maybe he will say, I don't know. Or maybe he will accuse the partner of his ex-wife, right? Okay.
Yes.
So after that, you can go for before, during, and after. Before, did you notice any vision problem or headache or anything before that? Did you notice heart racing before that? Okay. No need for orthostatic in this age, okay? Here, during this event, did he lose his consciousness? No. Did he get jerk movements? And if yes, did he fall down? Did he fall down? Okay. So did he wet himself? Did he injure himself? Did you notice any bleeding from any orifice? Clear, Dr. Nasser?
Yes.
If you will go step by step, everything will be easy. I can use who approach and I can use Odebara. See, both of them will guide me to the answer. I will explore data. I will take marks. Okay. So I will continue. Any did you notice he's like floppy? Okay. And so on. After that, ask about any feeling sick or throwing out. Okay. After that, any change in bowel or urine. 2 questions for urine and the bowel. No need to waste the time. Did you notice any change in bowel habit, in urine habit? Okay, done. After that, you can go for previous history. So any past medical disease, previous surgery, any prescribed medicine, any drug allergy, any, what about pregnancy, what about delivery, any admission after that, after what about immunization, up to date. After that, social, the most important here, social. Do you or your previous wife or ex-wife or her partner smoke, drink alcohol, or by any chance, any of you, sorry to say that, use any illicit drug? Okay. Any social services involved currently or previously? Okay. So here, if you will go step by step, everything will be smooth with you. You will save time. If you will count when I started the station, I will find it's like 3 minutes maximum. Okay. After that, the management plan. Here also, did you notice any drugs in his hand or mouth or pocket? Okay. If he mentioned, yeah, her partner is smoking, drinking alcohol, and using illicit drugs, it will be logic to ask, did you notice any tablet or drugs in his mouth or his pocket or his hand? Some candidate, he answered yes. Some candidate, he answered no. Okay. So what we are going to do now, in resuscitation room, check vital, examine him, complete examination, complete workup. Okay. And he might need imaging for his head. Okay. Because abnormal behavior. Okay. Also, blood test here, hematology, biochemistry, biochemistry, culture, and toxicology screen. Clear, Dr. Nasser?
Okay.
Yeah, well done. We'll go next station. Dr. Abu Yahya, anyone did not practice, want to practice?
Yes, Doctor.
Dr. Al-Hamidi, okay. Okay, you have 30 seconds.
Okay.
You can start.
I need to wash my hand and wear PPE. Good evening. I am Dr. Abdulaziz, ED Registrar. May I know your name and relation to Hatem?
Yeah, I am Nadia. I am his mother. He's 3 years.
Nice to meet you, Miss Nadia. I have been asked to take some data from you regarding Hatem. I am going to take some personal question, which is we asked all the patient came to ED. Is it okay with you?
Okay.
Did anyone attend with you?
No.
Would you mind if nurse attend with us?
Okay.
How can I help you today?
Yeah. He has cheek swelling.
I'm sorry to hear that. Do you mean right or left cheek?
Yeah, this one.
Does he in pain?
I give him painkiller.
Is he comfortable now?
Yeah, yeah.
I will check vital sign for the patient. Can you tell me more about? Don't worry about your child. He will be in safe hand of our team. Can you tell me more about the cheek swelling of your son?
Yeah, this one started for 3 days, increasing, worsening, and I seek medical help for his doctor, but no benefit.
Started suddenly or gradually?
Gradually.
I'm sorry to hear that. Anything make it worse or improve?
No idea, doctor.
Okay. Does he have fever?
No.
Night sweating?
No.
Any masses in other part of his body?
No, no.
Did he lose appetite or weight?
No.
Any skin changes?
Yeah, this one only redness in his face.
I'm sorry to hear that. Does he have any fast breathing, shortness of breathing, wheezy or cough?
No.
Did he have any throwing out or feeling sick or diarrhea?
No.
Or tummy pain?
No.
Did he have before the same problem?
No.
Is he have any chest pain or heart racing or dizziness?
No.
Does he have any numbness, weakness, or paralysis in any part of his body?
No.
Does he have any painful urination or urethral discharge or change in the color or smell of urine?
No, no.
How's the pregnancy of the baby when he was
Normal.
pregnant?
Normal.
And his delivery?
Normal.
After delivery, did he admitted or
No.
he go? How's his growing and development?
Normal.
Life. Is he immunized?
Yeah.
Does any medical diseases run in? Did he have any medical diseases?
No.
Did he do any surgery or admitted before to the hospital?
No.
Did he take any prescribed medication or have any allergy?
No.
Any family disease? Any diseases run in the family?
No.
I want to ask some question about the social for the patient. Any career for Hatem?
No.
Where does he live and with whom?
Me and his father in downtown.
Where is his father?
He's on way now.
Did you inform him?
Yeah.
About the condition? Any other living in the home with Hatem, smoking, drinking alcohol, or by any chance using illicit drug?
No.
Okay. Do you have any information you want to tell me about Hatem?
No.
Have you traveled anywhere recently?
Thank you, Dr. Hamedi. Thank you. Okay. Here, what is the management plan? I will give you 20 seconds.
What is your concern?
Yeah, I am worried, doctor. What is the problem? And what will I do now?
Swelling of the cheek. Actually, there is a lot of differential diagnosis. Maybe infection to the tooth, maybe parotid gland, maybe masses, malignancy, maybe trauma, or other causes. So we will keep Hatem in observation room, and we will take some lab investigation, and we will consult the pediatrician, and after that we will tell you we will discuss with you the plan of management. Actually, most probably we will discharge the Hatem with antibiotic if all lab investigation within normal. Did you understand what I told you?
Okay, thank you, Dr.
You're welcome.
Okay, here I want you to ask the most important questions. Number one. Number two, try to phrase your questions. You have problem in phrasing the questions. Okay, this will happen if you are writing a question. I can find you are searching for questions. Okay, so for example, past medical disease, any past medical disease done. Don't change the question, don't search for a formula for the question. Okay, also about immunization. What about his immunization? Up to date? Like that. Okay, I want you to write these questions 1 time, 2 times, 3 times. It means if you will write all the general approach of history, be sure you will get 10 out of 10 in any history taken in the exam. Okay, so
you mean doctor, every session we have to write it and to memorize it, right?
I mean the general approach. For example, past medical disease fixes that in all history taking. Any past medical disease done. Okay, so try to write this question. I can see you are searching. What will you say? Okay, so quickly, any past medical disease, any previous surgery, any disease run in your family, any prescribed medicines, any allergy. Clear, Dr. Al-Humaidi?
Yeah, clear. Thank you, doctor.
Okay, so here in this patient, the most important airway, the patient has cheek swelling, right?
Yes.
Guys, cheek swelling. So the most important for you, airway and the feeding. Airway, the first killer. And if the patient is not taking his feed properly, he will die also. Okay, so what about his breathing? What about his feeding? 2 points you have to ask. Okay, but in its place, so you will go for Odibara. You did well in Odibara. What is the most relevant system here?
Upper respiratory and skin and mucinous.
So
and GIT also.
Here you can ask about if you want to go for GIT, if you want to go for respiratory first, it's up to you. No worries. The most important, you can ask, can you tell me more about that? What happened? So if she did not inform you about teeth infection or teeth pain, so you can ask her directly. Is that happen after teeth pain or tooth pain? She will say yes. Okay. So here in the management plan, in the end, you will involve a dentist. Okay, because she will accept that. Okay. So anyway, in the management plan, you will do X-ray for the face. You will do infection screen. Okay, means full blood count, blood gases, blood culture. Also here, according to the X-ray, you want to see if this one also related to eye or not. You have to ask the mother, does he have any problem in vision? Maybe it's affecting his vision. Also, CNS problem. Maybe it's related to brain infection, right, Dr. Al-Hamadi? So here, any infection in this area, it can go for eye, it can cause, what is the problem, guys? What is the complication expected?
Periorbital abscess.
Cellulitis. Okay, so I have a concern as a physician. You have to tell the mother, I have a concern as a physician. Maybe this infection will be spread to his eyes, maybe spread to his brain. Okay, so I need to give him antibiotic after infection screen. Okay, so here blood culture, you will do blood gases, you will do blah 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 blah. Okay, and you will consult dentists. Remember that. Okay, guys. Yeah. Next one, we will go back. Anyone?
Dr. Hani, can I practice? Yeah.
Yeah, Dr. Meliti. Okay. You can raise your hand, guys. If you want to practice, you can raise your hand. Okay. You can start.
Yes, good morning. This is Dr. Hussam, one of the AD registrars. May I confirm your name and your relationship to Tahar, please?
Yeah, I'm his mother. He is 4 years.
How are you today?
Okay.
How is Tahar?
He's okay.
Okay, so Tahar is with one of my teams. They're gonna take care of him. And be sure that he's in a safe hand. Meanwhile, I would like to take some information, some data regarding his complaint. Will this be okay for you?
Yeah, just to give him painkiller and we can go.
It's okay. We're gonna take care of him. Can you tell me more why you brought Tahar today?
Yeah, he has throat pain.
I'm very sorry to hear that. So can you tell me more about this throat pain?
Yeah, this one started 3 days ago, and it's increasing.
Right, and where exactly is in the middle of the throat or in the neck
his
down?
throat, in throat.
Right, right. And is this affecting his daily activities?
No.
Does it go anywhere else in the body, this pain, or just in the throat?
No.
Okay, and is it improving or worsening, or is just the same?
Worsening.
Okay, and is there anything that makes this throat pain better?
Right, doctor.
Anything that make it worse?
Doctor, just to give painkiller and we can go.
Sure. Yeah, my team already gave him some pain reliever. He's okay
So
now.
we can go. You are asking me many questions for what? He has throat pain.
I understand your feeling, but this is really important for his general health, and I need to take some more information from you just for a better management. I think you agree with me.
Okay.
Is it okay to continue?
Okay.
Thank you. Did he have any fever or shortness of breath?
No.
Any cough?
No.
Any wheezes?
No.
Okay. Did he have any skin rash?
No.
Any change in weight or change in appetite recently?
No.
Any night sweating?
He doesn't have anything, doctor.
Okay, okay. Is there any, does he have any past medical issues, Tahar?
No.
Okay, and how was the pregnancy with Tahar? Was there anything, any complication during his
Normal.
pregnancy?
Normal.
It was normal vaginal delivery?
Yeah.
Okay, and after delivery, he was not admitted to the ICU or any neonatal care, right?
Yeah.
Okay, and his development is good?
Yeah.
What about his immunization?
Okay.
Okay, okay, that's really good. May I ask you, where do you live? Where does Tahar, with whom does Tahar live?
Yeah, with me.
Okay, and his father is with you as well?
No, I'm divorced.
I'm very sorry to hear that. So, do you have any other kids at home or just Tahar?
Just Tahar.
Okay. Do you smoke or drink alcohol?
Yeah, sometime.
Okay. Sorry to ask you this question. By any chance, do you use any recreational drugs at home?
Yeah, sometimes. So, is it related to throat pain?
It's just a routine question that I ask for everyone. May I ask you if Tahar have been ever seen by any social service before?
Yeah, before, yeah.
May I know for what?
I cannot remember.
Okay, okay. So, would you like to add anything? Is there anything that I'm missing here?
No, doctor, just give painkiller and I will go home.
Okay, sure. Now, Tahar presented here because of sore throat, as I understand from you, and we're going to take care of this. We're going to do some investigation. We're going to check his vital sign and do some blood tests. We're probably going to give him some medication that will make him better. However, I just noticed here while I'm checking his X-ray that Tahar have a fracture in his one of the arm bone. Do you have any idea about that?
No.
Okay, so he didn't develop any trauma or fell down recently?
I don't know.
Okay. Sorry, can you remind me of your name again?
I'm Nadia.
Okay. So Nadia, just for the best interest of Tahar, I think that Tahar have a fracture in his arm, and we need to investigate more about why did he develop this fracture, and we need to work together to see what causes this fracture. This is very important. You can't remember anything by any chance?
No.
Okay, so my plan, Miss Nadia, I'm gonna admit Tahar in the hospital. I need to consult the orthopedic team and the pediatric team for this fracture, as he will most likely require further intervention. Maybe he will require surgeries for this. Do you agree about this plan?
Thank you.
Okay.
Okay, I will give you 20 seconds.
Okay, Miss Nadia, do you agree about what I said?
I want to go home, doctor.
Yeah, I'm very sorry. I don't think that Tahar can go home with such fracture. As I told you, he has a fracture in his arm, and he must be admitted here, and maybe he will require surgery. Orthopedic team must see him before, because you don't have any idea about how did this fracture happen. In this case, I would like to inform the social service to be informed, to be involved as well. Do you agree about this plan?
No.
Nadia, this is very important. I think that me and you should agree about your child's healthcare. If you still didn't agree, I'm sorry to tell you that I have to admit him despite you not agreeing, and I have to involve the social service and the police as well. This Tahar cannot go home today. Sorry about that. Is that okay with you?
Okay, thank you, Dr. Hussein. Well done. Okay, I want to hear from other guys.
Yeah, yes, well done. His communication is very good.
Okay.
about the case, or you want to hear about the presentation or about the case?
The presentation and the case.
The presentation very nice, and then mashallah, he is covering the most important.
Okay.
Point. But regarding the case itself, as we raising the non-incidental injury,
okay,
we should admit the patient, and we should ask also one about the other kids, if there is other kids in the home. We need also to take care of that.
But in the management plan, you should give a little more detail, like in the best interest of the child, we are doing all this, blah, blah, like that.
If she even disagree, she have no authority. If we are suspecting such kind of injury.
Okay.
Yeah, we are legally bound to admit this patient, but mashallah, he was very fine, because even before initially he was on not track, and even that he did not confuse, and he run station very smooth way. Means he knows these things what I have to do. Yeah, but when he's continuously saying that I want to go home, that just he can explore any reason why she want to go home now immediately. Yeah.
Yeah. Okay.
Hani, just one question. If the carer get angry and he feels accusing him, so what to do in this case?
Okay, we will answer this one. I want to listen from. I want to hear from everyone.
I have also one question. This from the start, I can ask her why delayed presentation, or if she seek any medical advice before this time for her sore throat. And what about this about the sibling and where she is living and like this from the start?
Okay, why this station? It's a non-accidental injury.
And there's one point. We need also to do another X-ray.
Long bone fracture.
Another X-ray, body survey.
Yes,
for the patient.
Yeah.
And also this seeking medical advice after 3 days.
Yeah, and because she came here for another reason.
And also this medical
presentation. The presentation is sore throat, not.
It's very so the mechanism of injury not consistent with the history.
Yeah.
Yes.
Okay. So if she came, for example, with limping and she has a fracture femur, it would be somehow logic, right? But she said sore throat and he has fracture, so non-accidental, obviously, right?
Yes.
Okay. So will you need more information regarding sore throat? You can skip.
No. Yes.
We can update this one. Just you can. How can I help you today? He has throat pain. I'm sorry to hear that. We will give him painkiller. Okay. Does he have any allergy? No. We will give him painkiller. And does he have any other symptoms? No. Any problem in his limbs? No. So here I wish if Dr. Hussam from the start, before he's talking to the patient, I need to turn off my belief. I want one nurse with me. We will be in private room. And also I need to check notes. I need to check X-ray, right? Before going to the patient. So the examiner will give you the notes. You can read that. After that, you can check the X-ray. It will be obvious in the exam. So after that, you can go to the patient and continue. Here, don't waste the time, Dr. Hussam, in doing analysis regarding the sore throat. Okay, right. Just painkiller. I will update this approach. Just the painkiller and ask her clearly, does he have any other symptoms apart from throat pain? If she said no, it's a logic to be non-accidental injury, because she said he doesn't have other symptoms. Okay, it means he doesn't have pain in his arm, or he doesn't have deformity in his arm. Okay, so at that moment, I want to inform you about his examination and his X-ray. We found he has contusions in his arm, and according to his X-ray, he has, I'm sorry to tell you, don't let her to feel that you are accusing him. Maybe you are showing here he fell down, okay? So I'm sorry to tell you that he has, if you want to say fracture, okay. If you want to say broken bone, okay. Both of them accepted nuance. In his arm, in the humerus bone, okay. Can you see that? Would you like me to show you the X-ray? You can take consent for teaching here regarding the X-ray. Okay. So do you have idea about that? Maybe she will admit. Yeah. I found him. He fell down the other day or last night, or maybe she will deny. No, I don't have idea about that. So why do you think he has this fracture? Ask her. You can explore more information. Check her answers. If she is really caring about her son, she will say, how this happened? So what we'll do now? And means it's not non-accidental injury. But if she said, I have no idea about that, I want to go home, and it means it's a non-accidental injury. Okay. So anyway, the management plan, you have to involve orthopedic, pediatrician, also do a skeletal survey, and you have to examine the patient. You have to do workup. You have to check other children at home. Okay. And you have to involve social services. Of course, after completing social history. Okay. So some people prefer to start by social history first. So I need to ask you some questions. We will be in private room, and also anything you will tell me will be confidential. She will ask you why you say like that. It's just a routine. We are doing that in all patients. Okay. So if you want to ask social history in the start, okay. If you want to keep social history in the end, it's okay. It's up to you. But the most important, don't waste the time with sore throat presentation. Okay, guys?
So, Dr. Hani, so before we proceed for the rest of the session, we can give information about the fracture, and we'll ask in history of presenting illness more details about it rather than in the end. That's what you're saying.
Yeah, the most important, address throat pain or address any complaint you will say in the start.
Okay, so give medication for the pain and explain about the fracture, then ask details from there.
And one point, ask here any other symptoms apart from throat pain. Why? It will be against the hair. Okay, so you are giving her a chance to talk. You are giving her a chance to talk about the fracture. Did you get my point?
Yeah. If she denied, that means that it's a NAI. Okay, we'll proceed like. Yeah.
For example, maybe she will think again. You are giving her to think again. Any other symptoms apart from throat pain? Maybe she will say, yeah, he has pain in his arm, right?
Yeah,
understand. Just to give her, the examiner will give you mark. Like sexual history, you don't want to ask about review of systems. So you can ask about genitourinary. After that, any other symptoms apart from the one you mentioned, he will say no. It means you ask about review of systems. Clear?
All system.
Yeah.
Okay. Yes.
So regarding Dr. Hani, regarding this developmental history and this like immunization and So that question we need to ask or no need to just means like
very important. Very important. The general approach is very important. You know why? Maybe he has a medical disease. Okay. That's why she hits him.
Yes.
Okay.
But
maybe
yes,
maybe he has for example heart disease, and always she's caring about him, and she cannot afford anymore. She's always angry to him. Okay. That's why she hit him. So you have to ask about general approach for past medical surgery, drug and allergy, social history here, very, very important.
Okay, it's like the same like ecstasy injection also. We'll proceed the station just like the same one.
Yeah, general approach. Just to follow the general approach. It will be easy for
you means like you means
but
in this case first we ask like regarding the sore throat, and then we ask for any other symptom. Then just we like ask developmental history, this immunization history, and then come on social history. Because once we open this like conflict, then maybe we forget and not go. So better to means like if we keep like this one, so better we rule out means those things, and then we enter on that thing. Is right way or no?
Some people they prefer to talk about the fracture in the end. Okay. Yeah, you know why? Because if you will talk about the fracture in the start, maybe she will be aggressive.
Yeah.
You cannot continue. The station will not be smooth. The station will be stiff with you. Okay. But if you, for example, I want to ask you a routine questions, and we are asking all people, and you can ask all social history first. Okay. For example, what is his father? Did you inform him? Any carer? And. She will answer all questions. What about his pregnancy? And. After you finish all, you can tell her, I check his notes, and I check his X-ray, and I found the blah 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 blah. Would you like me to show you the X-ray? So I'm sorry to tell you that he has blah, 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 and so on. Okay. I prefer this way.
Okay. Yeah. Right.
Yeah. Because at least you ask her 70% of all questions, and at least you get some high marks in this stage. Okay.
Yes.
Yeah. It will be smooth with you.
Thank you.
Okay. Dr. Abu Yahya.
Yes, Ani?
I want to hear from you.
Yeah. So in this regard, if we are suspecting that the patient has non-accidental injury, and we know that from the start we have the X-ray and we have the information that the
already they mentioned in the scenario. Yeah.
Yes, and they mentioned in the scenario clearly. So we usually start with this. We speak to the patient clearly, frankly, that this is what we are suspecting, that there is a fracture in, we have seen fracture in the X-ray. We want to know more about this fracture. So according to the answer of the mother, if the mother usually don't be judgmental that she's the one causing the non-accidental injury. It could be someone else at the house. So your tone will be, I want to clarify what's the cause of this injury. And according to the history, according to if she's answering honestly, if she's showing any empathy, because when you were the mother, you weren't concerning about this. This is also a red flag that there is no concerning that although the child has a fracture in the arm, still the mother is not concerning about this, and this is very strange. So you clarify about. I appreciate that you said you can take the history fully and then explore the fracture later on. But in practice, we usually explore it because this is the main concern at the moment. We need to know, we need to make sure what's going on, what's the history, why this patient is having this fracture, and it's not common in children to have a long bone fracture, and explore it more in non-judgmental tone at all. So not to make the mother offended, because if you speak in a suspicious way, or making the mother feel that you are accusing her, yes, she will shut down and you won't continue in this regard. This is how we approach it usually.
Yeah.
It's different from one-to-one, but the main thing is to be honest that we are very worried about this, what is going on, what happened to this child, how he sustained this injury, and then clarify about social history, who else live in the house, who visits, any adult, any friends, something like that.
Yeah. Thank you, Dr. Rabi. So anyway, guys, the most important, you have to check the notes and the X-ray. Anything available in the station, you have to check first before talking with the patient. Okay, so it means you are aware about the station first. It's in practice like that also. For example, your consultant asks you to go to this patient and to talk with him, and you did not check the notes. Can you talk to the patient or the relative? Guys?
No, how can we talk? We don't know the things here.
Yeah. So if your consultant asks you to talk to the relative about something, you have to check the file first, the notes. Okay. So how you talk with the patient and you did not check the notes? You have to show the examiner that you check the notes first, because it will give you marks. Okay. If you will not check the notes before, it will decrease your marks. If you will not check the X-ray before, it will decrease your marks. And also in all communication stations. For example, the patient has breaking bad news. If you will not check the notes, it will decrease your mark. And in the breaking bad news, they will mention clearly in the scenario, you have 1 minute to read the notes. This happened in previous exams. Okay, especially in the last exams. Okay, anyway, if the patient refused, so I think me and you, for the safety of the Tahir, we have to do complete examination and do a complete X-ray for his bones. Maybe he has another fracture. Don't be judgmental. Don't accuse her. Okay, you can say, I think me and you, I think you agree with me, for his safety, we should do further X-ray to check maybe he has another fracture in other side. Right, guys? So, and also you can say, in such a case, we should involve the pediatrician orthopedic, and in such a case, we should involve social services according to our policy. Okay, it means you are not accusing him. Okay, if she said, are you accusing me? And no, I am not accusing you. I think me and you, we should search for the reason behind that. Okay, and so on. Okay, next one.
Dr. Hani,
yeah.
Dr. Hani, I will not mention the word of non-accidental injury.
If you will mention, some people mention, some people don't prefer to mention, and I am one of them. Okay,
yes,
so
yeah,
it's up to you. If you will mention, no worries. If you will not mention, no worries. But for me, I don't prefer. Okay, and it will not affect your marks, whatever. For example, you can say to her, even you are not accusing her, I think me and you, this is non-accidental injury. It means you are not accusing her. Did you get my point?
Yes.
I think me and you agree with me, it's a non-accidental injury. And me and you, we should search for the reason behind that. It means you are showing here, maybe someone hit him, not her. Did you get my point?
Yes, Dr. Hani.
Yeah. So even you will mention it's a non-accidental injury to her, or you will not mention that, but at least show the examiner that you understand the station. It's a non-accidental. Okay.
What approach if she insist or she refuse to let the child be admitted, or to
step by step, escalate, always escalate. For number one, I think me and you, for his safety, we should search for the reason behind that. And also in such a case, we should search for other fracture. Maybe he has other fracture in his leg or in other arm. So we need to do complete skeletal survey. Okay. And in such a case, we should involve pediatrician and the social service. No, I want to go home. Why you want to go home? Can you tell me more? Any vulnerable adults at home, you want to care about them? Maybe her father at home, right? Sick. Any pets at home, you want to care about them? Maybe she has cat or anything, she's worried about her, about it. Okay. Any children at home, you are worried about them? Clear, guys? You should explore why she want to go home. Maybe she want to go home for something, and she will treat the child, right? Okay. But if she refuse the management at home, so I think me and you, we should search for his safety. If she's refusing, so I think me and you, we are not going anywhere. I have, in such a case, to involve the social services, legal office, and police. Clear, guys? Yeah. So in a way, step by step.
Also, this is the one of the examples that in this case we separate the mother and the child. They won't be in the same cubicle, and we will not allow the mother to see the child until the child is being checked by the senior pediatric consultant and social service. That's why even if she refuses and she wants to go, we won't give her the child back until the child is being checked and the social service has been involved. And so he refused, we just keep calm and try to reason with her. If he's still insisting on going or insisting on not want us to do anything for the child, then clearly we'll tell her that this is our suspicion and this is the policy. This is what will happen is to be checked by pediatric consultant. Social service will be involved. I'm sorry, he will be staying in the hospital.
Good. Yeah, thank you. Okay, so next station, it will be the same guys. Here, her mother with sore throat. This one we finished. Next station, it will be limbing. So it will be the same guys to not waste the time. Okay. Limbing for 2 days, and here you have to check the notes. It will be the same. Okay, we will go for this one. Who did not practice till now? Dr. Ines?
Yes.
Are you happy to practice this one?
Inshallah, yes.
Okay, you have 30 seconds.
I'm ready.
You can start.
Okay. Doctor, how are you? Wash my hand. How are you? I am Dr. Ines, emergency physician. May I know your name and relation to my patient Salim?
Yeah, I'm his father. I'm Fathi.
Nice to meet you, Mr. Fathi. Are you comfortable, Mr. Fathi?
I am not the patient.
I know. We can just go to the private room. We need to discuss. I need to discuss some issue with you about your son Salim. We need to take you to private room. I will take one nurse with me as a chaperone, and I will close my phone. I will announce my team where I am. Am I okay? I will hand over. Mr. Fathi, I want to. How you know so far about your situation of your son Salim?
Yeah, today I found him. He was collapsed, and I called the ambulance. They brought him here, and they moved him to resuscitation room. They give him treatment, but I don't know what happened after that.
You haven't any other idea about your child?
Yeah.
Before he has complaining of anything before his collapse?
No.
Your child?
No.
Okay. Just I want to give you some bad news. I need you to know your son Salim, he have diagnosed like he have diabetes. You know what's mean of diabetes?
No.
That is mean he have uncontrolled high blood sugar. In this age, that is mean he have diabetes mellitus, that is mean have uncontrolled high blood sugars, because there is some deficiency in one of his glands is secreting some hormone, its name insulin. He having this hormone, that is why he developed this diabetes, and it was not discovered and not treated. That is why he came with this complication. You understand what I'm saying?
Yeah.
Okay. I want just to tell you, this disease, it will be for life, for all his life. It will be like chronic. You have any past history in your family or mother family have this diabetes? No?
No.
That is me having the idea about that. Like I told you, he have this disease, it will be for all his life, and it will be replaced by some injection. He will take injection all his life to replace this hormone deficiency in his blood. This clear to you?
Yeah.
And now your child is little bit in unstable situation because this hormone is lack or deficient in his blood for a long time, and his body already developed some complication. We said like acidosis in his blood, and this need him to be admitted with us here for a long time. After we discharge your child, we will refer you to something after stabilize and fix it his dose. Will discharge him for diabetic doctor. He will follow him regularly. A nutritional doctor or tell you what he should be eat or what not. Is that clear to you? And you can manage this issue?
Yeah.
You have any question I can give you more?
Yeah, I'm worried he's 3 years and how he will manage that.
He cannot manage by himself. That is why I explained to you what I'm saying. He needs full support from you and from his mother. His mother is with you.
No.
And you are the only one to care him?
Yeah, she's at home.
She's at home. Yeah, she can be caring about him. We
Yeah.
will give you full teaching about this disease, how we manage it, and how we follow up in science, regular follow-up with the diabetic doctor, and we'll refer you to some like support team for teaching you how to deal with like this. Yeah, I know he's 3 years. That means he need from your side and your mother's side take caring of this disease.
Okay, so
clear to you?
yeah, so he will take tablet or injection.
No, injection. I told you injection. In this age, you should be taking injection because they have lack of this hormone. We will replace this hormone to him by injection, not like other ones. This time we said diabetic is lack of insulin, not like that other diabetes, we worry about it in the adult. It will be like resistant to insulin. We'll give some taps for decrease this resistance. But here in this age, is like lack of this hormone, and we'll give this hormone by injection. It will be injection, a regular checkup to his random blood glucose, and follow up with diabetic and nutritional as well.
Okay.
Okay. And now, like I told you, he have need intensive therapist. We keep him because he have some complication for this diabetic, After we'll stabilize, we'll fix all this follow-up. And if anytime you want to help how to deal with this disease, just ask us. We'll contact with the social and everything. You have another child at home?
No.
You need anyone to attend with you? I will call him.
No.
Okay. That is clear to you?
Yeah.
Okay. Salim, it will stay with us for a while till we stabilize him because he's unstable now. Later, we will discharge, then we'll inform you more about what will happen with diabetic and what will happen about nutritional. And if you want also, we can call for some supporting team to teach you more about how to give him injection and how this dose it will be and how we controlling this disease.
Okay, thank you. Thank you, Dr. Ines. Thank you. Okay. Okay, well done. Here, how you know the patient is stable or unstable?
Because metabolic acidosis and the rotiristic make the kick ID.
How you know this ABG it's now or yesterday or 1 week ago?
We ask about additional note.
It should be.
It's not about additional note. So no need to say to the patient, to the relative, he is unstable or stable or whatever. Okay. So he will stay. I'm talking about the short management. He will stay in ICU. Okay. He will receive all treatment needed, and after recovery, he can go to home. So here, just inform him about the short-term management in general. No need to talk in details. Okay, and long-term management. But before you talk about the management, ask him about his concern. Okay, in any station, before management, you will ask about what?
Ice.
Okay. So if you will start management now, think about ice. If you will mention management in the end of the station, think about ice. So before any management, ice. Okay. Clear, Dr. Ines? Yeah. So here you mentioned about I'm Dr. Ines. I'm the registrar, the most senior here, and I'm here to discuss with you condition of your son. May I know your name and the relationship with blah blah blah? Okay. So he will tell his name and how much do you know so far about his condition? Blah 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 blah. Okay. So yeah, it's correct. Would you like me to explain more? Maybe he doesn't want. Okay. So would you like me to explain more? Yeah. Okay. So you will inform him about according to his condition, according to his blood result, according to his blood gases, and he was seen by the medical team. Anything mentioned in the scenario, you can mention. But first of all, ask about additional notes. If no additional notes, at least you asked already. It will be counted for you. Okay. So, and he was seen by medical team, and they diagnosed him by disease which is called diabetes. Here, piece by piece. Do you have idea about that? Yes or no? He will depend on the station. Maybe he will say yes, maybe he will say no. Okay. So would you like me to explain more? Yeah. This one, it's high blood sugar. There is, if you want to say 2 types or 3 types, no worries. But no problem. You can say 2 types. 1 type in children, and type 2, it will be in adults in older age. Okay, so this one because of insulin deficiency, insulin hormone deficiency. Okay, he presented today with serious complication of this disease, which is called diabetic ketoacidosis. Do you have idea about that? No. Would you like me to explain more? Yeah. His blood has acidosis and his urine has ketones. Okay. And his blood sugar is very high. So what is your concern now? Maybe he will say how long he will stay here. And is it serious? Is it long life-term condition? I appreciate your concern. Yeah, he will stay here for a few days until he will be recovered normally. Okay, he will recover 100%, and after that he can go home with you. And regarding long-term management, he will be on insulin injection and with regular checkup of his blood sugar. And I will give you printed leaflets to teach you. I will give you websites. I will give you videos to guide you more regarding this new diagnosis. Okay. So you will give him more information about that. Okay. I will teach you and teach the carer for him, whatever his mother or okay. And the follow-up, as you said, with the diabetic doctor. Okay. After that, did you ask me about general approach of pediatric history, Dr. Ines?
I should ask prenatal, you mean? I don't know really.
Yeah, you finished everything. What I need from you, continue. What about his pregnancy? What about his delivery? Okay. What about any admission after? So just quickly, because you have to fill his notes, right? Okay. What happened with this patient in practice? The patient collapsed, right? The patient collapsed and you moved the patient in resuscitation room, okay? And you did all investigation, you diagnosed the patient with TKA. You give the patient management. After that, you went to the father to take history from him and explain the diagnosis for him. Is that clear? Is that clear, guys?
Yeah.
Yeah.
It's clear.
Yeah. So you will explain the diagnosis, but you don't have information. You have to fill the notes of the patient. You have to fill his history. So if the consultant asks you, what about his past medical disease? You will tell your consultant, I only explain the diagnosis. No, you have to explain the diagnosis and fill all the notes. Okay, and so on. So next one, doctor, who want to practice this one? Anyone did not practice, want to practice? Who is happy to practice this station?
Yeah, I can do it.
I can do it.
Okay. Dr. Ahmed Al-Amin?
Yes, Dr. Yani.
Yeah, you can do. You can start.
Okay, I'm going to wash my hand, put on my PPE. Hello, I am Dr. Ahmed Al-Amin, ED registrar. I believe you have a concern regarding one of the patients. Is this correct, sir?
Yeah.
Can I confirm your name and your relation to the patient?
Yeah, I am Fathi and my son Hatem, 4 years.
I see. So, sir, I came to explain to you regarding what happened to him and also to take some data from you. Would that be okay?
Yeah, yeah.
Okay, just to assure you that Hatem now is in our safe hand with our team in the ITU. Okay, can you tell me more about what exactly happened to him?
Yeah, he was collapsed today. Suddenly, I found him. He's confused, and I called the ambulance, and they brought him here to resuscitation home. They said they are giving him treatment, and this is what I know.
Oh, I'm so sorry to hear that. So let me explain to you a bit more about what happened. Actually, he came in a very critical condition. He was having a low blood pressure. He was having shortness of breath. He was received by our team, admitted to the ITU. He was given oxygen medications, and after blood tests were taken from him, I'm sorry to tell you that he was diagnosed by our endocrinology consultant to have Addison's disease. Sir, do you have any idea about that?
No.
Would you like me to explain a bit more?
Yeah, please.
Okay, Addison disease usually happens when the glands above the kidneys, we call them the suprarenal gland, fail to secrete their hormones. Usually two hormones are secreted, aldosterone and cortisol, and they are responsible to help the body face stresses as well as to regulate the chemistry of the blood, the electrolytes and the blood sugar. Is this clear for you, sir?
Yeah, yeah.
Now, your son came to us in a very critical condition, which is a complication of this problem called the Addisonian crisis. Okay, this is because of exposure to a kind of stress that he couldn't cope with. So that was the reason he was coming with the presentation I told you about. Is this clear to you?
Yeah.
Now, do you have any further questions so far or any concerns?
Yeah, so he will stay here now or he will go home? And is it serious condition? So it will happen again? I don't know.
Let me explain a bit more to you, sir. I'm so sorry for him. Actually, your son will stay at the time being in the ICU. He will continue to receive the medications and fluids, and he will receive replacement therapy for the deficient hormones. Okay, he will be discharged from the ICU when his condition improves and he becomes stable. Is this clear for you, sir?
Yeah.
Now, regarding the Addison's disease, I'm so sorry to tell you that it is a lifelong condition. Your son will always need to have cortisone tablets in order to help him to cope with any stresses. Is this clear for you?
Yeah.
Now, at any time when he is subjected to like infection or injury or any stress, he will need to increase the dose for this. And also he need to all the time keep with him some injections for cases of emergencies. Is this clear for you, sir?
Yeah, yeah.
Now, he will need also to have some like bracelets with the condition so that under emergency situation, the medical staff can know about his condition and deal with it. Okay. Also, I'm going to supply you with some leaflets and I will give you some website that will help you to understand more about this disease and how to deal with it in the future. It is clear for you, sir?
Yeah, yeah. Thank you.
Thank you, sir. Do you have any immediate questions for me right now?
At the moment, it's okay.
Okay, I would like to continue to take some data from you in order for the record of Hatem.
Yeah.
So, sir, can you tell me for how long he is suffering or since when he was complaining of this?
Yeah, he has some symptoms, but today suddenly collapsed.
Okay, for how long these symptoms?
Like 1 month.
Is it only today or for a couple of months? I see. And was it getting worse all the time?
I cannot remember.
Or sometime it was improving?
I cannot remember.
Okay. Okay. What about before? Is Hatem has any previous medical problems or any surgeries done for him?
No, no.
Okay. Is there any disease that run in the family?
No.
Any hospital admissions?
No.
What about his pregnancy and his delivery? Were they normal and his birth weight?
Yeah, normal.
Is his immunization is up to date and his growth and development normal?
Yeah.
Okay. Is there any carer for Hatim?
No.
Other than you, sir? Where does Hatim live and with whom?
With me and my wife.
Are there any other children at home?
No.
Do you have any financial problems?
No, no.
Anyone around Hatim is smoking, drinking alcohol, or by any chance taking any illicit drugs?
No.
Okay, sir. Thank you very much. That completes the data I need
Thank
from
you,
you.
Dr. Ahmed.
Okay. Thank you very much, Dr. Ahmed.
Okay. Well done. Amazing. Here I updated this one. I said no need to ask about present history. Okay. Don't waste the time. Just after you finish, yeah, after you finish explaining the diagnosis, the disease, the crisis, and then ICE, after that short and the long-term condition, you can proceed to previous or past medical and the surgery, okay?
Okay.
Regarding social history, don't waste the time in social history. Okay.
Okay. Because it was at the end, so nothing more.
That's why I in the end, even you will lose your time. At least you explain the diagnosis, the management plan, and everything, right? Yeah. So here, don't ask in details regarding social history. Okay. So the most important here, what do you do for living? Because you care about the child. What do you do for living? Any carer for Hatim, okay, and also where do you live, or where does he live, with whom? 3 questions only, more than enough, okay, because it's not about social history. And after that, any drug, any allergy, and more than enough to finish that. Well done, Dr. Ahmed. Thank you.
Dr. Hani,
yeah.
So after all the history, we don't need to give a management plan in the end, right? Because we have given already in the beginning.
Yeah.
So we just finish up to the last history and say thank you. That's all, right?
That's all. And here also, once you finish the management plan in the start, it means you are in safe side. Even the time will finish, you are in safe side. So after, what if you finish everything and you still have time? You can ask in details. For example, I ask about, I explain the disease, I explain the crisis, I ask about his eyes, I explain to him short-term management, long-term management, I ask about all history, and I still have time. I can ask more in social history, right?
Yes.
For example, I can say, sorry to ask you, but anyone care about him smoke or drink alcohol? I'm sorry to ask this question. Anyone by any chance use any illicit drugs? Okay, so any child, any other children at home, it's not important question, but you still have time. You can use this time, right?
So the majority of the marks is in first 3-4 minutes time.
Yes, excellent.
Yeah.
Thanks, this how to pass with 10 out of 10, guys, without effort. How to focus on the most important points. Where is the bulk of marks? Okay. So next station, it will be the same. Who want to practice this one?
Samih.
Okay, Dr. Sana, you can. You can start.
كان دكتور سامح النقدر great all. I'm Dr. Samih, emergency physician. May I know your name and I confirm your relationship with Fathi?
Yeah, I am Fathi, and my son is Fatah. He's 5 years.
Nice to meet Mr. Fathi. Mr. Fathi, we need to go to private area, and one nurse will be with us, and I will hand my bleed to one of my colleagues and notify about where am I. It is good for you. Is it good with you?
Yeah.
Mr. Fathi, may I know what are you know so far about Mr. Fathi?
Yeah, today I found him. He is fighting for breathing. I called the ambulance and they brought him here. They said they moved him to resuscitation room. They give him nebulization, oxygen, and they inserted tube in his airway. I don't know what happened after that.
Okay, Mr. Fathi. I'm sorry to hear that. Now I would like to inform you that he is on a good hand with our team. Take care of him, and actually he is presenting to us with a critical condition called asthma. I'm sorry to tell you that. Do you know what asthma is?
No.
Actually, this asthma is narrowing in his air passage, lead to let him suffering to take a breath. This narrowing can be occurred due to an external stimulus, and actually no one know exactly which stimulus can cause this to him. Is it that clear with you?
Okay.
And for this condition, he may need some medicine to help him to breathe normally. We call it bronchodilator. It will dilate his air passage. Is that clear for you, Mr.
Yeah, yeah, yeah.
Currently, he is admitted in ITU, and he will be there until his situation will be stable. And after that, we will discharge him with medicine. It will be with him forever, unfortunately. And it will used when he is having same condition. Is that clear for you?
Yeah, yeah.
And meanwhile, I will support you, and I will supply you with some leaflet and some website and some social group to let you learn more about this medicine, about this disease, and how you can face it.
Thank you.
You are welcome. Mr. Fathi, may I have some additional data from you regarding Fatih's
Yeah, yeah, yeah.
condition?
Yeah.
Did he suffer from this condition before?
This is the first time.
This is the first time. And did he have any past medical history?
No.
Did he have any past surgical history?
No.
Did anyone in your family have a similar condition?
No.
Any medical condition in your family? May I ask a bit information about his developmental? He was how his pregnancy
Normal.
period, and how his delivery safe in hospital?
Normal. Normal.
And what about post delivery? Any complication? Anything?
No, no.
Did he is taking his immunization up to date?
Up to date.
Okay, thank you. Again, I would ask some question. Did anyone in your family by any chance smoke or take alcohol?
No, no.
Okay. Did you have any additional concern to be clarified for you?
Yeah. So is this long-term condition? He will take this medicine forever?
I appreciate your concern, Mr. Father. Yes, this is a long-term disease. It will happen. It may happen again, and it may happen again by same severity as I mentioned before, because this can be triggered by any outside stimulus, like some dust, some smoke, some change in weather, some perfume, like that. And in this case, he will be supplied by medicine that help him to dilate his air passage that cause for him this condition. Is it clear for you?
Yeah, yeah, clear.
Did you have any other
So,
concern, Mr. Father?
so he will use inhaler, this inhaler preventer or treatment?
So this is a very nice question from your side. We have actually two type of inhaler in this kind of disease. The first one is therapeutic inhaler, and this inhaler will be used at the time of attack, like what happened today. It will help him immediately to dilate his air passage. The other one, we use it as a prevention for this disease to lower the inflammation that's going on his air passage. This will be taken twice a day, whatever his condition. If he have attack or he have no attack. Is it that clear for you?
Yeah, clear.
Thank you. And if you have any more questions, we are here to help you. Don't hesitate to ask us.
Okay. Thank you, Dr. Sama. Well done. Amazing. Okay. Well done. If you will go step by step, believe me, guys, in any station, it will be smooth. Okay. Just to follow the steps and make notes for yourself. So, number one, like that, number two, like that. And the most important, general approach. If you will memorize the general approach, it will help you to save time. Okay. And once you will find any new station, at least you will ask the general approach, believe me, more than 6 marks, even if new station. Okay. And so on. Okay. We will stop here today. We finished already. Okay. Anyone has any question?
Because regarding this information that I supply us, like ABG result, I need to tell the father about this ABG finding, or just this is for my knowledge.
Actually, you can say he came in critical condition. We did blah 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 blah. Anything mentioned in the scenario, and if you have notes in the station, so anything provided, you have to inform him. For example, you can say we did for him blood gases. We did for him blood tests. Okay, but don't invent.
Okay.
If no blood gases in the scenario, don't say we did blood gases, right?
Okay. Yes.
Yeah, it means that, guys, it's in practice. If your consultant asks you to talk with the patient, you will invent or you will check his file and inform him anything done.
Tell what you have from information.
Yes. Okay. You tell him facts. Don't invent. If you will invent in the station, it means you will invent in practice. Okay. So, for example, patient intubated. It's not mentioned in the scenario. But if the actor said he has tube in his airway, so yes, correct. You can confirm that from him. No worries, because anything mentioned in the scenario or mentioned by the actor, it's a fact. Clear, guys? Yeah. Any other question? Yeah. Any other question? Okay. Thank you, guys, and bye.
Thank you.
Thank you, Dr.
Thank you, Dr. Hani.
Thank you, Dr. Hani.
Thank you, Dr. Hani.
Thank you.